University, Professor J.I. Ike Chebelo. As early as 8 a.m. we were in our midst, our former provost, our former dean, Professor Gerald Okanandru Udigwe. Prof, we deeply appreciate all you do for the obstetrics world, the academic world, and of course the NMA. And we have our own NMA elder, lowly confirmed Nwofor, Professor Richard Nwofor. Prof, is a deep pleasure to have you in our midst. We also have our renowned consultant obstetrician and gynecologist, Dr. Raphael N. Omaliko, Chairman Elders Forum, Anambra State. It's a deep pleasure to have you in our midst. We also have a former NMA chairman who tried his tenure for a lot of things. Distinguished colleagues, Dr. Ekwesianya O is in our midst. Todike is in our midst. Huh? We also have seated on the same table, Dr. Chikwendo Madukres, consultant obstetrics, obstetrician, gynecologist. Wonderful people. It's a pleasure to have you in our midst. Distinguished colleagues, ladies and gentlemen, where we move right, we move left. You can see our own foremost orthopedic surgeon, our own professor, former head of the Department of Surgery, Professor Chima I Ihegihu. Prof, it's a pleasure to have you in our midst. And on the same table in that wonderful place, you can see our only alert CMD. He does it as he moves. At times, his alerts will get even to non-consultants at the teaching hospital. He spreads it randomly at times. Professor Osita Igwebwe, Otugo Nnewi, Ifemba Opo. It's a pleasure to have you in our midst. And seated on that same table is a former head of the Department of Obstetrics and Gynecology, Professor Emeka Ezama. He gets younger as things get tough in Nigeria. As things are getting tougher, the younger he becomes. You can go and verify. Chief Mbeledogo, Bo, is it not what it is? And we can see our own teacher. He has a peculiar way of teaching anatomy. Professor Lasbury Asamoah. Professor, it's really a pleasure to have you in our midst. Thank you so much for all you do. These are the people that taught histology without textbooks. These are the people, there's a way he presents, NASFIC, hope you remember, the columnar epithelium. There's a way he presents that and you start enjoying anatomy. You know, cuboidal epithelium. And when he mentions it with that his angelic voice, you have no other option than to learn this. Professor, we deeply appreciate all you do. And all members of the table where Ahoma is in charge. I can see Reverend Sister there. I can see Dr. Mrs. Ugu there. I can see Nasfik. Wonderful people. It's really a pleasure to have you in our midst. And you can see where Professor Ekunife is, the Dean of Dentistry. And of course, the Editor-in-Chief of Orient Journal of Medicine. These are wonderful people that make things happen. And we're always happy when we see them. Distinguished colleagues, ladies and gentlemen, the wonderful students. I can see where you are, doing justice to our breakfast. And of course, warming up to do a lot of things when you're called upon. I hope you had scientific presentations. Hope you had papers here today. Because we gave you time for Young Doctors Forum, you know. But eventually there are no doctors again. The young ones have gone. They've all gone. See, it's scientifically proven because the 1 hour we allotted to them, they couldn't use all of them. Dr. Aroa, how is the axis? They require. Hope you're good to go because we have men that matter in the medical world here. You entertain them like You're not in Nigeria, okay? You can see how perfectly you're dressed. Professor J.O. Ugu has been my boss on this stage and the chairman of the Scientific Forum. Chief, you need to be close so that we know when we start and then move immediately. The program for today's event is actually on page 20. It's on page 20. And we can see that once we start, we are going to end early so that we move into the annual general meeting. Dr. Tony Okoye, Akanyanya, past state sec, Akanyanya. It's a pleasure to have you in our midst. Dr. Udobi of Radiology, HOD. It's a pleasure to have you. You know, there's a difference between head and HOD. HOD represents that you have vector quantity, have magnitude and direction. But once we call you head, you know what that means. Then we have the Chineke group. Are they still there? Professor Ugu, we're looking for the Chineke group. Okay, they were there before. It's really a pleasure to have all of you in our midst. The State NMA Chairman, LOC Chairman, Dr. MP Obiebu, please, we need you close too. Professor Ugu, we are waiting for your signal so that we can start constituting the high table so that we hand over the mic to our own chairman, Professor A.M.E. Nwofor, who will guide us on the proceedings for today. Distinguished colleagues, ladies and gentlemen, the 6th Professor F.A. Festus Aghagbo Nwako lectures is today. Our dear former acting Vice Chancellor, 2 terms acting Vice Chancellor, nobody has achieved that feat before, is here to do justice to that very topic. And we have the representatives of the F.A. Nwako family. For the students, hope you know Professor F.A. Nwako. If you don't know him, if you go to the university permanent site at Oka, you see the big auditorium. It's named after the renowned pediatric surgeon who trained the likes of Chief Ekunife, Professor Ekunife, Professor Ugu, and a lot of surgeons here. He is one of the few surgeons that when they carry the pediatric baby, the baby never cries. Go and check, he is documented. Even if the baby is crying, once Professor Nwako puts the baby on his laps, that baby must stop crying. And we have the family here, ably led by no other person than the amiable daughter, Dr. Adora Ziba Nwako. It's a pleasure to have you in our midst. As medical students, whenever we are with Prof, it's either he's receiving a call from you or he's smiling after receiving your call. So even when we've not seen you for a very long time, we know the name. We also have Dr. Cyprian Nwako, the nephew. And we also have Elizabeth Ikechukwu, the niece. They are here to be part and parcel of this all-important event. 6th Professor Festus Aghagbo Nwako. Today is the day. The event is here. And the time is 11 a.m. The chairman of the occasion is here. The guest lecturer is here. Former CMDs, former provosts, many deans, our lecturers are here. What else are we waiting for? than to start this all-important event. Distinguished colleagues, ladies and gentlemen, may we invite to the high table the chairman of today's event, many times head Department of Surgery, Dean Faculty of Medicine, Provost College of Health Sciences, Editor-in-Chief of many journals with impact factors, member of all professional bodies, presently the chairman of the Faculty of Surgery, National Postgraduate Medical College of Nigeria, a consummate urologist, our father, our mentor. Shall we invite to the high table Professor Alexander Madabrochukwu Ekunife Nwofor. A round of applause is here. Distinguished colleagues, ladies and gentlemen, is here. Distinguished colleagues, ladies and gentlemen, to join him immediately at the high table is one-time digital dean, one-time director of academic planning, one-time deputy vice chancellor, one-time acting vice chancellor. He left, he came back. He served the second term as an acting vice chancellor of Nnamdi Azikiwe University. Distinguished colleagues, ladies and gentlemen, one of the few obstetricians, gynecologists that will keep getting younger as things get tougher in Nigeria, Professor Joseph Ifeanyi Ikechebelu. Please, a round of applause. He's a stickler for time. He's here time for time to do justice to this all-important event. The event is today. For the medical students here, we must appreciate his input in the field of surgery. It is our day. The event is here. We thank you so much for all you do, Prof. This is the man that made the country to stand still for months. And he was back as the acting vice chancellor. His tenure was very productive, and Prof, we deeply appreciate you for all you do. It's a pleasure to have you in our midst. Distinguished colleagues, ladies and gentlemen, the representatives of the Nwako family, this is their event. In surgery, we say this is their show. In our midst is no other person than Dr. Adora Ziba Nwako. Please, let's lead her to the high table. She'll be joined by all the representatives of the Nwako family, Dr. Cyprian Nwako, and of course, Elizabeth Ikechukwu. All wonderful relatives of our revered, foremost pediatric surgeon, the man who had the history of separating the Siamese twins. Hope I'm in order. Has any other person done that? Is there another person threatening to do it? Who is about to you? A round of applause. A round of applause. Our former provost, our former dean, the man who can be in Atlanta, Georgia in the morning and at Nnewi in the evening. Distinguished colleagues, he's still getting younger as things get tougher. Professor Gerard Okanando Udigwe. Distinguished colleagues, ladies and gentlemen, as he's going up to the high table, shall we invite the chairman of Anambra State, a worthy obstetrician gynecologist, Dr. Prince Eston. Chief Prince Eston. Okay. Please, a round of applause as he walks up to the high table. When you see that cap, you remember those Echilechi in different fields, you know, and is led by the LOC chairman of this all-important event, Dr. MP Obiebu. Onga funa de neme chairman na neto. Lokwa na aka prof TGM nucleate proptate. Imana chifugu ima aka nika prof na je editing. That's why I'm born at Kuzigi. If you are never a prof he may be thinking he's already enucleating. So name chairman, watch those fingers. You can enucleate anything anytime. And then I can join. You know, prof of the right. So when you're teaching the careful. Ladies and gentlemen, I've been informed that our last CMD is here. And we have to invite our own CMD Namdes Teaching Hospital, Professor Osita Igwebwe, Otugo Nnewi, Ifembo. Please, a round of applause for him as he comes up to the high table. Distinguished colleagues, ladies and gentlemen, our own former digital dean, former head of Department of Pediatrics, Professor E.F. Ugochukwu. Please, a round of applause as she comes up to the high table to be part of this all-important event. Professor E.F. Ugochukwu. Distinguished colleagues, ladies and gentlemen, ladies and gentlemen, shall we invite table conferred with the powers to assess the mental health of virtually everyone here. He also is a sub-team speaker for today, and he's an elder of MA. The only confirmed and authentic Nwofor, Professor Richard Nwofor. To join him is a former NMA chairman Anambra State. The colleagues, ladies and gentlemen, Dr. Ekwesianya Emmanuel. Etodike. We wait for the representative of the Anambra State government and, of course, other sub-team speakers. I was about to invite the elders, but I've been informed the elders are more comfortable watching proceedings from there, the Red Cap Chief. Thank you so much for all you do. Distinguished colleagues, ladies and gentlemen, we deeply appreciate all of us for our presence in this all-important event. With approval of the opening ceremony, Professor A.M. Nwofor, shall we rise for the national anthem? DJ. Thank you so much. May I invite Reverend Sister Aham Azomta for the opening prayer.
May we rise for an opening prayer. In the name of the Father, and of the Son, and of the Holy Spirit. Heavenly Father, we thank you for the gift of this wonderful day. We thank you for who you are and what you are in our life, for your preciousness towards us, for bringing us safely to this all-important event, NMA 2026 Annual General Meeting and Scientific Conference. Thank you, Lord, for being with us. Continue to be with us in this conference. Make it a huge success for the greater glory of your name. Continue to strengthen us as we serve in your healing ministry. Make our prayers through Christ our Lord. In the name of the Father, and the Son, and of the Holy Spirit. Amen. Thank you.
Thank you so much, Reverend Sister Oma. LOC Chairman, please, can you bring the cola nut to the state chairman, who will present that to the chairman of today's occasion, Professor A.M.E. Nwofor.
The chairman of NMA Anambra State, the guest speaker for today, members of Nwako family who we are recognizing today, members of the high table, members of Anambra State NMA Executive Committee, colleagues, ladies and gentlemen, I welcome all of you to this event, which is part of the program for this year's NMA activities. The essence of this is actually to honor our father, who is Emeritus Professor Nwako of blessed memory. He actually traversed this scene as a very good medical practitioner, and he blazed the trail in pediatric surgery in our region. So it is a very good thing that NMA Anambra State instituted this very noble thing, the lecture series. And we are now at the 6th lecture. If I look around, I see so many people, several generations of doctors and doctors to be. All that means is that we are growing. That means that the foundation that they laid is continuing to sprout and give rise to new things. Today, we are going to hear again about Emeritus Professor Nwako, some reflections on his life and times. And then we're going to cap it out with the academic lecture, which is the hallmark of what he believed in. And I think, well, let me conclude this before the color. Thank you. So, I believe that we are going to go away from this place with a lot of new knowledge, and we are going to be happy for it. So I ask all of you to sit and enjoy yourselves as we progress in the program. Thank you. Oji nwa biago. Aha. Si me ete semen. Chairman. Chairman Oji abia.
The chairman of the occasion, Enenebako. I present this caller to you on behalf of Nnewi, Anambra State. Kimeze Kesemia, Dalusa.
Dalogio. Ndeba nekwe na oji ebutela anyo. Ya no na bataga anya ofuma. Yes, all them man. Okpakwuri aka nku. Chairman NMA. Avo mo people n'isi tata. Ka I try and ka I man we mo vacation. I'm handing the cooler back to you.
Nke a set up. Mana man neto dike zomo ofuma. So na atụrụ si n'ebulu egwu bata n'ama nni ọ mara agba agba ome gịnị and ọkụ agụnyekwana nwata n'aka onye eme gịnị onye arụgbu ya ndị be anyị ọjị abịa nụ nke m metara na anabata nke m emetara mana dịka m si wee mụta anyị aha ọma bịa ka ibugheli ọjị a bịa ka ibugheli anyị ọjị ka ndị Nnewi were mma ewepụtagoro nke na-eme Anambra steeti na-eme eji m ọjị unu chairman of the occasion ga-ewere ọjị kedu aha ọma nwa bunye m ọjị bịa ibulu ọjị jebugala igwe Nnewi anya bụrụ royal father of the day anyanwa ya awụkwa nna anyị ọjị a Igwe Nnewi or his representative Weloji. Onye Nnewi ọzọ n'ebe a Wejalu Chikwendo. Bịa ọ dịka onwe onye tọọ Chikwendo n'ebe a. Chikwendo chọọ onye tọọ gị nye ọjị. Guest speaker of the day, my own mentor, Professor J.I. Kechebel. Ndị be Nwako, onwe nwoke nọ n'ime ha. Nye ọjị, maka nwaanyị anyị emetụkwa ọjị anyị aka. Ana m emetakwa ya chairman. Kwa na-emetụ ya. Okay, well, Oji Wegalo, past state chairman, Nnewi Anambra State, Dr. Ekwesi Anya. Okay. Dalo. Biko, onwe ndị broda anyị si n'obodo ndị ọzọ bịa, Nnewi Enugu Abia, Ebonyi, Imo. Ọ bụ na o nwere ịma nke nji ya cover ha ncha. Ndị zone ya were ọjị. Well, ọjị aja wegalo Nnewi zone ka o wepụta ọjị n'afa ndị the zone. Yes, nya welo n'afa ndị zone niile. MDCAN leadership are not here. When you see them, they can not here. Okay, ahụ m ihe wepụtazi nke fọ n'afa ndị affiliate niile. And ndị mgbakwunye dị na-eme biko onwe nke fọn inyelu m ichie enyi n'afa ndị medical elders ndị be anyị echekwanụ n'ọgakwanụ n'round biko eye weluzi igwe eji ekwu okwu inye onye Nnewi n'ọhịa the elders ka owazela anyị ọjị. Okay.
N'ebe anyị enwekwa n'ọjị ekwu na onye wetalụ ọjị wetalụ ndụ, so anyị na-eme for today ewetago ndụ n'obodo a, and ọgbakọ anyị bịa ga-abụ ọgbakọ ga-ewetala anyị ọganiru, wetala anyị ndụ n'afa Jizọs Kraịst bụ onye nwe anyị. Amen.
Ọ sị kedu nke etore?
Chikwendo.
Ọ sị nọ Chikwendo.
Biko tuo ya Chikwendo. Biko ndị ọbụla jizi ọjị ka ọfọsọlụ na ibi ele nụ. Daalụ na ewelụkwa m igwe eji ekwu okwu nye chairman of the occasion. Thank you, Prof.
Ladies and gentlemen, unu na-anya na okwu unu ji, go back to page 23. There's an event that we must observe. We're going to redeclare our physician's pledge. So we're all going to stand up. Yes. And the state chairman will lead us. He will read and we follow.
Please, may we rise as we reaffirm. Okay. All right. May we stand up? Please, you repeat after me. As a member of the medical profession, I solemnly pledge to dedicate my life to the service of humanity. The health and well-being of my patients will be my first consideration. I will respect the autonomy and dignity of my patients. I will maintain utmost respect for human life. I will not permit consideration of age, disease or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between me and my duty and my patients, I will respect the secrets that are confided in me even after the patient has died. I will practice my profession with conscience and dignity and in accordance with the good medical practice. I will foster the honor and noble traditions of the medical profession. I will give to my teachers, colleagues, and students the respect and gratitude that is their due. I would share my medical knowledge for the benefit of the patient and advancement of healthcare. I will attend to my own health, well-being, and abilities in order to provide care of highest standard. I will not use my medical knowledge to violate human rights and civil liberties, even under threat. I make these promises solemnly, freely, and upon my honor. So help me God. Thank you.
Yeah. Yeah, take over.
Thank you so much, our chairman of the opening ceremony and the chairman of NMA, for moderating that. Let me quickly invite the chairman of the local organizing committee, our own obstetric psychologist, Dr. MP Obiebu, for the speech by the LOC chairman.
Okay. Welcome, welcome, welcome. On behalf of the LOC, I welcome you all to this AGM, Annual General Meeting and Scientific Conference, with the 6th Nwako lecture, starting today and ending tomorrow. I want to welcome my leaders and past leaders, my medical elders, professors, trainers of my trainers, colleagues, students, and members of the press. I also want to use this opportunity to say welcome to our sponsors. That is the management of Nnamdi Azikiwe University Teaching Hospital, the management of Chukwuemeka Odumegwu Ojukwu University Teaching Hospital, the management of Federal Medical Center Onitsha, and also our individual sponsors, Dr. Bon Osai, Professor Prince Ele, Dr. Godson Okeke, Dr. Samuel Okoli, Dr. Patrick Okolo. I also want to welcome the awardees, the Vice Chancellor, Professor Bond, and also Professor Ezeja for the immediate past CMAC, Nnamdi Azikiwe University Teaching Hospital, and Dr. Maureen Umakwewulu, the CMD, Chukwuemeka Odumegwu Ojukwu University Teaching Hospital. I say welcome to you all today for leaving your busy schedules and being here today. Thank you and welcome. Thank you.
Thank you so much, LOC chairman, for that wonderful one. Thank you so much. Before I invite the state chairman speech, I quickly recognize the presence of the immediate past chief medical director of the Chukwuemeka Odumegwu Ojukwu University Teaching Hospital, former commissioner for health, Dr. Joe Akabike. It's a pleasure to have you in our midst. May I quickly recognize the presence of the Dean Faculty of Basic Clinical Sciences, Professor Eloilo. He's on the same table with our own neurosurgeon, Dr. SPU Nkwerem. Let me quickly invite the chairman of NMA Anambra State, Dr. Prince Sexton Akam, for that address by the chairman NMA Anambra State. As he's doing that, the Herald Choir, you should be getting set to give us your best before we take the presentation on Emeritus Professor Nwako.
It's no akam ko akam na Sibutu Abacha. I greet you. The MC, the chairman of the occasion, Professor A.M.E. Nwofor, the guest speaker, Professor J.I.K. Chebel, my boss, APA CMD, Professor Anthony Gwebwe, my own immediate past provost, Professor Gerald Udigwe, Eziogo Moke, all the members of the high table, Mommy, Professor Gochuku, I recognize you and everyone. I greet everyone in the house. It's a great pleasure and a singular honor to welcome all of us to this hallowed audience, esteemed colleagues, distinguished guests, friends and well-wishers to the 2026 NMA Anambra State Annual General Meeting, Scientific Conference, and 6th Emeritus Professor Nwako Memorial Lecture and Awards ceremony holding from 17th today to tomorrow, 18th July 2026 at the Classic Munich Hotel, Nnewi. This is our second AGM and marks the end of the 2024 to 2026 administration. This is the 6th Emeritus Professor Nwako, Festus Nwako Memorial Lecture is a biannual lecture series to be delivered by our very own Professor J.I.K. Chebelo. Is also a key component of this year's AGM under the distinguished chairmanship of Professor Alexander M.E. Nwofor. AGM usually affords us an opportunity to interact with one another as members of NMA and to interface with the key relevant stakeholders, government agencies, and policymakers on issues affecting doctors and the healthcare system at large. It also provides avenue for continuing professional development via lectures and scientific sessions. Today's event also witnesses conferment of Distinguished Merit Award to the following colleagues: Professor Gochukwu Bon Stanley Anyehi, the Vice Chancellor of Nnamdi University; Dr. Maureen Uche Umakwe Ulu, Chief Medical Director, Coates, Oka, and Professor Ogochukwu Ezejofor, the immediate past CMAC of Nnewi. These awardees were carefully selected in recognition of their giant strands and achievements in the field of medicine and in the various positions of responsibility held at different levels within the state and beyond, and their services to humanity at large. Their profiles are intimidating and indeed justify the conferment of these NMA State Merit Awards on them. The Day 2 activity, which will continue tomorrow, will witness continuation of scientific session, team and sub-team lectures, luncheon, AGM election of new state officers. This year's theme, the future of medicine in Nigeria, doctors as system architects, innovations, workforce sustainability, and university health survival. And the sub-team, medicine under pressure, insecurity, violence against healthcare workers, workforce migration, and struggle for healthcare survival. We're aptly choosing to reflect the current realities, and we have no doubt that the erudite resource persons will do justice to the topics. My profound gratitude goes to His Excellency, the Executive Governor of Anambra State, Professor Charles C. Soludo, the Solution Governor, through the Honorable Commissioner of Health, Dr. Afam Obidike, for giving healthcare system in Anambra State the facelift through infrastructural upgrade, personnel recruitment, free antenatal care and delivery, and various innovative programs, including but not limited to introduction of telemedicine in Anambra State, even as we hope for a more robust relationship with NMA and doctors, both in public and private establishments, as a panacea to achieving his dream healthcare delivery system to Anambra. I also profusely appreciate the NMA National Body, ably led by Professor Fekindene Somoti, the Anambra State Officers Committee, the State Executive Council, the Congress, as well as members of the 2026 AGM Scientific Conference, LOC, ably led by Dr. Obiebu Dozie and co-chaired by Dr. Anthony Ude. The 6th Emeritus Professor Nwako Memorial Lecture, LOC, ably led by our own Professor Jidofo Ugu, and the various subcommittee heads for all your support, efforts, and sacrifices towards achieving a successful AGM. To our distinguished guests, dignitaries, friends, and well-wishers, thank you for honoring us today with your presence and support. Please enjoy the rest of the event. Thank you all and warm regards. Dr. Princeton Okam, Chairman NMA Anambra State. Thank you.
Thank you so much, Dr. Princeton Okam, for that one. Thank you so much. Before we invite the Herald Choir, with the permission of the chairman of today's event, may I quickly recognize the presence of our distinguished elders and colleagues who just joined us. Some of them were here earlier. The foundation member of NMA Nnewi Zone and the retired chief medical officer, Dr. Madoka Ernest Chukwujeku. Thank you so much for all you do, sir. We deeply appreciate. Also in our midst is the MD of Best Hospital, Oko, Dr. Okoye CC. We also have in our midst Honorable Barrister Dr. J.I. Nwokeji. On the same table with Dr. Chigozie Ajoko. And we also have in our midst a consultant ophthalmologist, Dr. Ejike Igboegu, and Dr. Chika Amobi. These are wonderful ophthalmologists. We keep hearing about them. It's a pleasure to have all of you in our midst. Distinguished colleagues, ladies and gentlemen, the Herald Choir. The chairman is here. Our former acting vice chancellor is here. Entertain them.
More than my mouth can testify, more than my mind can comprehend. I've seen the wonders of your grace. I'm sure that this is not the end. Ezebube, see how far you've brought me. Ezebube, I'm so glad you found me worthy. I can see, I can tell, and I know it's your grace. All my days I will sing your praise. More than my mouth can testify, more than my mind can comprehend. I've seen the wonders of your grace. I'm sure that this is not the end. Oh, Ezebube, see how far you brought me. Ezebube, I'm so glad you found me worthy. I can see, I can tell, and I know it's your grace. All my days I will sing your praise. Ezebube, see how far you brought me. Ezebube, I'm so glad you found me worthy. I can see, I can tell, and I know it's your grace. All my days I will sing your praise. Ezebube, see how far you brought me. Ezebube, I'm so glad you found me worthy. I can see, I can tell, and I know it's your grace. All my days I will sing your praise.
I can see, I can tell, and I know
Please, another round of applause. Please, another round of applause. While the song was going on, I was looking at my friend Nkwerem. Hope the song was touching your heart. Dr. Aru Andubisi, hope the song was permeating your heart. Thank you so much. Thank you so much. Distinguished colleagues, ladies and gentlemen, while that presentation was going on, may you quickly recognize the presence of our foremost orthopedic surgeon, Dr. Ngozi Chukwuka. Chief, it's a pleasure to have you in our midst, seated on the same table with Dr. our own E. coli. It's a pleasure to have you in our midst. And then Professor Umononihu Omene. Thank you so much for all you do. I think with the permission of the chairman, this is the right time for us to have the reflections on the life and times of our own Emeritus Professor Festus Aghagbo Nwako.
In the words of John Ruskin, the highest reward for a person's toil is not what they get for it, but what they become by it. This clearly defines the life and times of Emeritus Professor Festus Aghagbo Nwako, Obata, a master of the scalpel, a mentor to many, a professor of professors, and a champion of pediatric surgery. Born on 19th October 1933 to the family of Elder Timothy Anakudo Nwako and Mrs. Agnes Mboli Nwako, née Akabolu, from Urumpi, Orofia Village, Abagana, Njikoka local government area of Anambra State, Nigeria. Young Festus Nwako attended Christ the King Primary School, Aba, from 1940 to 1946. He proceeded to the prestigious St. Patrick's College, Calabar, for his secondary education in 1946 and graduated in 1951 with flying colors. His excellent result earned him a teaching job at his alma mater as a science, mathematics, and language tutor in 1952. He also taught at the Igbo National College, Aba, in 1953. His passion for education led him beyond the shores of Nigeria for the Medical School of National University, Ireland, from 1954 to 1960, where he bagged his MBBCH BAO honors degree in medicine. Dr. Festus Nwako obtained a higher degree in the same National University, Ireland, where he bagged his MCH in 1964. Due to his exceptional brilliance, he earned a federal government scholarship in medicine, the University of Ireland's first and second year prizes in medicine, as well as the final year prize in surgery. While in medical practice, Dr. Festus Nwako was a workaholic. His career spanned 44 glorious years. Armed with his surgeon's skills, his passion for teaching, and his curiosity as a scholar, he bestrode the world of pediatric surgery and left indelible marks that the Nigerian Medical Association, Nnewi Anambra State Chapter, celebrates him till date. He was a senior registrar, Department of Surgery, University College Hospital, UCH, Ibadan, 1963 to 1965. Senior Force Foundation Fellow in Pediatric Surgery, Johns Hopkins Hospital, Baltimore, USA, 1960. Lecturer in Pediatric Surgery, University of Nigeria Teaching Hospital, UNTH, Enugu, and the University of Nigeria, Enugu Campus, UNEC, 1967 to 1971. Heinz Fellow 1, Pediatric Surgery, 1971. He rose to the rank of a professor in pediatric surgery in 1975 and subsequently became the head, Department of Surgery, University of Nigeria, Nsukka, from 1975 to 1978. Between the same 1975 and 1978, he was also the Associate Dean of Medicine, and by 1978 to 1979, he was the Dean, Faculty of Medicine, University of Nigeria, Nsukka. In his exponential career growth, He rose to the position of Deputy Chairman, Medical Director of University of Nigeria Teaching Hospital, UNTH, Enugu, from 1975 to 1979, and subsequently the Chairman, Medical Director, UNTH, 1979 to 1980. Professor Festus Nwako rose to the pinnacle of his career in 1991 when he was strongly recommended by the Owele of Onitsha, the Right Honorable Nnamdi Azikiwe, while giving his consent to the renaming of the then Anambra State University of Technology, ASUTEC, Awka, after him. Consequently, Professor Festus Aghagbo Nwako served as the pioneer Vice-Chancellor of Nnamdi Azikiwe University, Awka, from 1991 to 1998. While serving as the VC UNIZIC, Professor Nwako also became a consultant pediatric surgeon, Nnamdi Azikiwe University Teaching Hospital, Nayut, Nnewi, from 1991 to 2000. He retired meritoriously in 2004 after an eventful 44 long years. He was conferred with the status of Emeritus Professor, Nnamdi Azikiwe University, in 2005 and a 4-star general in pediatric surgery and academics. Emeritus Professor Festus Aghagbo Nwako left a litany of evergreen memories on the sands of time with numerous academic sons and daughters who have taken some pages from his copious legacies in the world of pediatric surgery. Beyond his towering height in pediatric surgery, Emeritus Professor Nwako also distinguished himself as an administrator. He sat in various boards. He was chairman, Management Board, Abakaliki Specialist Hospital, Abakaliki, 1989 to 1990. Honorary Citizen of Louisville and Commonwealth of Kentucky, USA, 1994. President, West African College of Surgeons, 1995 to 1997. Coordinator and National Delegate, International Surgical Society, 1995 to 1998. Officer of the Order, National du Lion, OONL, Senegal, 1997. Chairman, Nigerian Institute of Medical Research, NIMA, Yaba, Lagos, 2000 to 2006. Chairman, Pro-Chancellor, Anambra State University of Technology, ASUTEC, Uli, 2005 to 2006, among other administrative offices he held. As an academic, Professor Nwako published widely, both in local, national, and international journals. He attended more than 30 international conferences and seminars where he presented over 25 invited papers. He authored and co-authored about 8 textbooks that are cited globally. He was an editorial advisor, editorial board of Nigerian Journal of Surgery, and member, editorial board, West African Journal of Medicine. He was indeed a colossus in the field of medicine and surgery. As a family man, Emeritus Professor Festus Aghagbo Nwako married Mrs. Stella Nwako in 1967, and their marriage is blessed with a daughter, Dr. Adora Dennis. He also has 3 grandchildren. Socially, Professor Nwako played lawn tennis at his leisure time. He was a regular player at Enugu Sports Club. He traveled to London annually for many years to watch the Wimbledon Open live. He was the patron P&T Vasco da Gama in the Nigerian football, where he was the team's doctor for many years. Professor Nwako was an ardent English football lover. He was an Arsenal passionate fan. For all the numerous achievements in his lifetime before he died on 16 February 2014, Emeritus Professor Festus Nwako is fondly remembered by posterity. The gigantic Nnamdi Azikiwe University Library is named after him. The Professor Festus Nwako Foundation and the biennial Emeritus Professor Festus Aghagbo Nwako Memorial Lecture, organized by the Nigerian Medical Association, NMA, Anambra State Chapter, are some of his outstanding memorials. This is the man we have gathered here to celebrate today.
where they described him as a 4-star general. I think he should be 5-star. So that 4-star, I was asking Professor Ugu the reason for why they stopped at 4. Because if they stop at 4, I think that's the maximum. Because he hit the zenith. Thank you so much for all you do. Before we invite the man that will give citation to our guest lecturer for today, may I quickly recognize the presence of our own Dr. O.M. Ogele, a consummate obstetrician gynecologist. He does virtually everything with ease. It's a pleasure to have you in our midst. He's seated very close to former dean and former head of anatomy, Professor Ngwobia Okoha. Prof, it's a pleasure to have you in our midst. Thank you so much. May we invite to the stage the Chief Medical Director of Anambra University Teaching Hospital, ably represented by our own Dr. Aloysius Odele Okoye. He's coming up to the high table to represent the CMD. Odele? No. Distinguished colleagues, ladies and gentlemen, the royal father of the day, Igwe K.O.N. Orizu, Igwe Nnewi, Igwe Nejoka, ably represented by Prince Obianefo Orizu. Please, let's lead the Igwe in. Igwe Nejoka, Igwe Nnewi, the oldest monarch. Very peaceful, very lively, very active. And that's why Nnewi has been very, very progressive in virtually all domains. He is represented today by no other person than Prince Obianefo Orizu. Prince, it's really a pleasure to have you in our midst. Thank you so much for all you do. You're welcome, sir. You're welcome, sir. Ladies and gentlemen, the stage is set. With the approval of the chairman of today's event, our own father, our own mentor, it's time for us to give the citation of the 6th Nwako lecturer, who is no other person than the many times acting vice chancellor of Anambra University. He is here live. May I invite Dr. Victor Modekwe. We call him Modekwe when there is crisis. He's a leader of the MD Kong. And we also know what MD Kong stood for. So that combination today between Modekwe and the former acting vice chancellor, let's watch what plays out. Dr. Modekwe, welcome.
Probably was a setup by the organizing committee. The chairman of the occasion and members of NM and audience, I happen to be the last senior registrar of Professor Nwako. And I must appreciate the CMD of Nawut, who initiated this lecture as chairman of Nnewi Zonal NMA. I'm here to introduce or remind us about the man who will give the lecture of today for Nwako Memorial Lecture. He's not a person than Professor Joseph Ifeanyi Kechebelo, a 1988 graduate of University of Nigeria, Nsukka, who obtained his fellowship in obstetrics and gynecology in the West African College of Surgeons in 1997. I think I was writing my WAEC that year and that time. He's also a fellow of the International College of Surgeons and a fellow of the National Postgraduate Medical College of Nigeria, and also a fellow of Policy or Institute Management and Development. He's also recently the fellow of the West African College of Obstetricians and Gynecologists and of the Royal College of Obstetricians and Gynecologists. He's a foundation fellow of the Academy of Medicine Specialists, FA-MEDX, and also a fellow of the Nigerian Academy of Medicine. He holds a PhD with specialization in human reproduction and women health from UNN, and also has a Doctor of Medicine of the National Postgraduate Medical College of Nigeria. in gynecological endoscopy. Professor Ketebelo is a professor of obstetrics and gynecology at Nnamdi Azikiwe University since 2008 and honorary chief consultant in obs and gynecology of Nnamdi Azikiwe University Hospital. He has held many positions in the university, like the head of Department of Obs and Gynecology, sub-dean student affairs of the College of Health Sciences of the same university, and dean faculty of medicine. He has coordinated the transparency, discipline, and monitoring unit of UNIZIC, and has been the director of UNIZIC Consultative Services, and also a one-time director of academic planning, DAP, of the same university, a two-time deputy vice chancellor administration, and an active vice chancellor of Nnamdi Azikiwe University. I've been a member of the governing board of Nnamdi Azikiwe University Teaching Hospital, Nnewi. He's been the secretary of the Faculty of Obs and Gynecology and a two-time chairman of the Faculty of Obs and Gynecology, West African College of Surgeons. Professor Ketebelo has published primarily in reproductive health, specifically gynecological endoscopy, infertility, stroke assisted reproductive technology, and women's health. He has authored over 200 journal publications, 9 book chapters, and 5 books, and over 50 conference presentations. He has over 6,400 scholars, Google Scholar citations. His H index is 36, and his I-10 index is 106. He's a scholar of the highest repute. He's committed mainly to postgraduate training, clinical innovations, and gynecological endoscopy in Nigeria and the West African sub-region. He's developed an innovative triangular 3-bite technique for treating cervical sacrilege, known as Ketebelo's technique. You can do that very well. He has mentored several fellows, carried out several assessments for professorship, and has led accreditation team to many obs and gynecological undergraduate and postgraduate training centers in Nigeria and the entire West African sub-region. Professor Ketebelo has been a medical educator during his tenure as the head of the Department of Obs and Gynecology. He initiated and edited a book for labor ward protocols known as Nayut Handbook of Obs Gynae Care. I'm sure many of us comes across that. The book is in its second edition and has helped many medical students and nurse officers and practitioners in caring for the pregnant women. As the Dean of Medicine, he established the first collaborative research unit in the faculty called Effective Care Research Unit, which helped a great number of university staff achieve visible high-impact publications. He also produced the first handbook for the MBBS program with details of the curriculum and lecture schedules and relevant postings. It's still in existence till date. He pioneered the provision of PMTCT, the prevention of mother-to-child transmission of HIV services in Nnewi, after being trained in US by the Institute of Human Virology, Baltimore, in 2003. He's been a member of the National Task Force team of the Federal Ministry of Health, Nigeria, for the prevention of mother-to-child transmission of HIV since its inception in 2003. He was the pioneer editor-in-chief of the Journal of HIV and Human Reproductive Technology, Human Reproduction, published by the PMTCT of the National Task Force team. He also pioneered the establishment of minimal access surgery, laparoscopy at Nnewi, and has continued to lead the gynecological endoscopy team in Nnewi, which has transformed women's health services, particularly in infertility management in the institute. He founded the Life Institute for Endoscopy, a Nigerian premier training institute for minimalized surgery, which has trained over 450 doctors and 50 perioperative nurses in the field of minimalized surgery as the course director. Professor Ketebelo has been the chairman of the Faculty of Obs and Gynecology of the Western College of Surgeons. He's been the chief examiner at the faculty professional examination at both primary membership and fellowship and post-fellowship level from 2019 to 2023. He's worked very hard to improve the pass rate in all the examinations, especially membership examination with the OSCE format, which is introduced, and has improved the pass rate from 20% to 50% in 2023. He conducted the accreditation of several centers for residence training in obs and gynecology in the region. He succeeded in completely transforming the primary course to a virtual course on Zoom with involvement of the whole West African sub-region. He initiated the transition of the faculty from true and false MCQ to the single best answers option, and the complete transition from essay papers to the total use of computer-based tests as a reliable screening method for crossover to clinical examination. He also initiated and completed transition from traditional clinical exam format to the OSCE type in the same faculty. initiating and complete development of a standard checklist for the assessment of the research proposal, final dissertation, and case books of the candidate of the final fellowship examination of the faculty. There are many things to say about these great men. Ladies and gentlemen, I wish to present to you Professor Ikechebulu, an astute administrator, a distinguished professor of obs and gynecology, a reproductive endoscopic surgeon, a fertility expert, an accomplished entrepreneur, a philanthropist, a humble and silent achiever, a man of excellence after God's heart, Professor J.I. Ikechebulu. Please, a hand of applause for him.
Thank you so much for this introduction. I was wondering whether he was talking about somebody else. So I decided to just match up to him and start this presentation. But I appreciate what my very good friend Victor MD Con and all the details that he has given us today. So thank you so much for that introduction. I'm here to take the 6th Professor Emeritus, Professor Nwako Memorial Lecture. And we have titled this lecture, "About this time next year, your tears will be turned to joy." Hello? I say the title is "About this time next year, your tears will be turned to joy." I want to invite you to listen very well, because we are going to not just give a lecture, but to a great extent, we are going to speak into your life and into your future. Let me recognize the chairman of the occasion, Professor Nwofor, Alexander Nwofor, or Xander, as we call him, and we have said so many things about him, and the chairman of the Nigerian Medical Association, Anambra State, Dr. Princeton Okam, who has left to attend to some things now. The provost of the College of Health Sciences has just arrived, and he just moved to the back of the seat, but he's here with us, Professor J.K.C. Emejulu, popularly called Chifu. I recognize you. The His Royal Majesty, the Igwe of Nnewi, Kenneth Orizu III, ably represented by the Crown Prince, and I also recognize your presence here. The eminent, the chairman of the chief medical director of our own teaching hospital here, Professor Joseph Ubaja, ably represented here by the chairman medical advisory committee, Dr. Odele, the daughter of Emeritus Professor Nwako, who is also here, and that is Ada Nwako. Ikporo anyị Ada Nwako, ikporo gị n'isi. Ihe ndị ọzọ niile bụzi additions to it. And all the professors here on the head table, I recognize you, Nkoe Chirinyazelo, and ladies and gentlemen, all my colleagues here, all the MDs of different hospitals in Anambra State and beyond, all the professors seated in the audience, all my colleagues, senior and junior, and all our medical students, all the students who are here, we are all recognized, and I want to take that as Having satisfied all the protocol, ladies and gentlemen, as for conflict of interest, I have nothing to declare. I think my screen is blocking the image, but I need this screen because this is some distance. Okay, fine. Okay. As for preamble, I will say that it's actually a divine arrangement for me to give this lecture. Because when I was approached to give this lecture, I looked at it very well and I said, why me at this point in time? Professor Emeritus Professor Nwako had so many mentees, so many products and the rest of others, and they called me. But on my own right, I've had some encounter with Professor Emeritus Professor Nwako. First was as a medical student in 1983 to 1988 at University of Nigeria Enugu campus and at the University of Nigeria Teaching Hospital. He was our lecturer and he taught us, and I will still give a typical example of one of the excellent ways he teaches. I also encountered him as the Vice Chancellor of Anambra University when I finished and joined the Anambra University. And also, as you will rightly know, that I also encountered him as an indigene of Abagana. That is Mbagana. And so he is my brother. And that's a very important one also. So I have every right to actually speak as on this platform, on this Emeritus Professor Nwako lecture. And I want to thank the Nigerian Medical Association, the chairman, and the local organizing committee actually for selecting me to give this presentation today. Professor Ugwu, the day they came to me, I had to take some time to ask them questions whether they are sure that it is me. But when they declared they are sure, I decided I will do justice to this. We've been given the preambles of Professor Emeritus Professor Nwako's life, so I won't go through that again. So if I can skip all that and go to my encounter with him, because I want to share those experiences. We summarize this life by saying that he's widely respected for combining clinical excellence, exceptional teaching skills, and university administration. These three qualities define this man. Let me illustrate his teaching excellence. When I was a medical student, we all came into his ground round, and he brought a guy, a young man who had, not a young man, an older man, who had a varicose vein on one of his legs. And he asked us simple question as medical students. My medical students here are listening very well because you will learn something as I learned a long time ago. And he asked us a very simple question. Why is this vein coiling up in this man's leg? He showed us the same vein in the left leg, either right or left. One was varicose and the other one was not varicose. I say, the same vein on this leg is not coiling, but it's the same vein. So why is this one coiling? Of course, with our little knowledge of medicine at that point in time, it was either my M1 or M2 posting. We gave all reasons, as we are taught, oncotic pressure, this, collapse of veins and every other thing, and we quoted all these, and he said, they are not the primary reason why this vein has coiled in the leg. We are asked, the simple question is, why is this vein convoluted? And why is the other one still straight on the line? And he answered us and said, very simple. This vein has become longer than the leg by the fact that the vein had stretched and it has become longer than the leg. It still has to be accommodated in the same length of the leg. And the only way it can be accommodated in the same length of the leg, is for it to take a tortuous movement. And it was a very wonderful lesson that day, and I have kept it since then. And of course, when he asks you a question like this and you didn't, you are not succeeding with it, Professor Nwako will call you goat. And when he called us goat, we are all worried. Have we become goats? But his goat is not the animal goat. His own goat, when he says to you as a goat, he says G-O-A-T, greatest of all times. It means he's impacting on you for you to become the greatest of all time. And we learned that and we continued with that. So that was my first encounter. That was a profound encounter with Professor Festus Nwako. If you also look at in the area of clinical excellence, his famous surgical expertise came to bear in 1976 when he led a multidisciplinary surgical team in Anambra, in teaching hospital, UNTH Enugu then. And they did the separation of the conjoined twins, which then we used to call Siamese twins. That was the first of its kind in the African continent. And the success of that operation demonstrated that complex surgeries or surgical procedure could be performed successfully in Nigeria and establish UNTH as a leading surgical center in the continent. And so he did that, and having done that, there's something very important about his doing that. He said that brought a renewed hope to a seemingly hopeless situation. This couple had delivery of twins, and they were overjoyed that they had twins. But suddenly the twins came out and they were joined together. A blessing of God suddenly turned into a seemingly curse because these twins were joined together. And so that surgical attempt to separate these twins became successful and informed the choice of this my topic, because what he did then brought a miracle to that couple, brought joy to them, changed their thinking, and the joy of having a baby was once again restored to them. And seeing this kind of medical miracle, it informed the choice of my topic today, to say that right from then till today, things have been happening, and we now called it about this time next year, your tears shall be turned to joy. And I will tell you why it is about this time next year that your tears will be turned to joy. Let me take you further on this. This statement has been ages past. Looking at the biblical foundation of this statement, in Genesis chapter 18 and verse 10, the Lord said, I will surely return to you about this time next year, and Sarah your wife shall have a son. Sarah did not believe this, as she laughed and wondered, how could this be now that she was old? She was already menopausal. And so how could it happen that she will have a son by this time next year? And her laughing was to say, please, don't lift my hope and crash it again. But this is a saying from the Lord himself. In Genesis chapter 21, verses 1 and 2, the Lord visited Sarah as he had said. And the Lord did to Sarah as he had promised. And Sarah conceived and bore Abraham a son in his old age, and at the time which God has spoken to him. So God started this about this time next year. Something will happen. Let us look at another place where this statement was also made. In 2 Kings chapter 4. Okay. In 2 Kings chapter 4, verses 16 to 17. Elisha said, in the first instance, God said. In second instance, Elisha said, at this season, about this time next year, you shall embrace a son. And she said, no, my Lord, O man of God, do not lie to your servants. But the woman conceived, and she bore a son about that time, the following spring, as Elisha said unto her. Ladies and gentlemen, it simply means that about this time next year, if you really believe and accept the word that it has come unto you, it means that something different will happen. And that's what I bring to you today, that about this time next year, what will happen? Today, many couples, the journey toward parenthood has become a long road filled with disappointments, silent tears, social pressure, anxiety, and emotional pain. And as they are passing through this challenge, science has come again to speak and to say that about this time next year, your tears shall be wiped away, and you shall have a son or a daughter of your own. And what is that science that has made this statement? That science is assisted reproductive technology. Hello? Did you hear that? It's the science of assisted reproductive technology. In the first instance, God said. In the second instance, Elisha said. And according to their word, it came to pass. In this third instance, what are we saying? Assisted reproductive technology is saying to you, about this time next year, you shall have a son, you shall have a daughter, and your tears will be wiped away. I want you to move with me on this journey so that we can see how we will prophesy to women who are here, to men who are here, that about this time next year, your tears of barrenness, your tears of childlessness shall be wiped away. And so it shall be in Jesus' name. Is somebody hearing the sound of my voice? Hello? Let's move on. Understanding infertility. In the next slide, it says, infertility is the inability of a couple to have a child, even in the midst of unprotected sexual intercourse for a period of 1 year. But WHO has said, even when once the lady is above 35 years, we are saying that you don't need to wait for a year. 6 months into your marriage, and you still cannot have a child, seek medical advice. The problems could arise from the male, the female, and it could be a combined factor, and it may be unexplained. I will not take us through the different challenges and the different causes that will bring this on. But let us understand the burden that these women with infertility will be facing. The couple with infertility. First is emotional issues. They are going through so much emotion, saying to themselves, hey, God, is it why me? I have seen couples. The lady was a virgin when she married her husband, and still they cannot have a child. And they are asking that question, why me? The young man has kept himself, was practically living in the church and doing everything, praying all the prayers. And by the time he decided now to take a wife, there is no child. And he's asking a question, is it a cause? So there is so much emotional trauma. It has also gone to be a social stigma. People look at people who have failed marriages as if to say that their marriage has failed if there is no child. And that's what is happening in our society today. there is also the financial burden of moving from place to place. Just like it happened in the Bible, and they said that woman with issue of blood has suffered so many things in the hand of physicians. Let me tell you, couple with infertility, they have suffered so many things in the hand of who? It's not just physicians, so they have suffered so many things in the hands of prayer houses, in the hands of fake, in the hands of charlatans, in the hands of those who are even planting and unplanting and doing so many things. There are so many things going on now. And this is peculiar also in African and Nigerian setting, where having a child is very important. And not just having a child, having a male child who can inherit and continue the lineage. So these challenges are there. And in most instances, women are blamed. But I have a research I did in 2003, as far back as 2003. And we found out that more men have infertility today than women, because male factor has increased and is actually the leading cause of infertility today. But you know that in Nigerian setting, in Igbo setting, and in other African settings, whether a man can perform or he cannot perform, once he has married a woman, that man is fertile, and anything that happens, the man is not to be blamed. But we will get to that. So I want to say that women coupled with infertility, they need compassion, they need support. If you see them, please take time. Either you pray for them or direct them to the appropriate place to go, and things will happen. And that brings us to this assisted reproductive technology that we want to talk about today. Is a medical technique, assisted conception, a medical technique for assisting a couple, a man and a woman, to have a pregnancy. So every method that we deploy to assist, either by the sperm or by the egg or by the embryo, to ensure that a pregnancy is achieved, that's what we call assisted conception. The first of its kind happened in 1978 when Louis Brown was born, and it was done by Robert Edward, Patrick Steptoe, who was the gynecology, Robert Edward was the embryologist, and a nurse called Pody was a counselor. And they worked on this, and they came up with this test tube baby. They had several, missed attempts, or let's call it near misses. But eventually they succeeded and gave that delivery in 1978, and that was Louis Brown. Since then till today, this technology has continued to multiply and deliver babies to families. And that's why I say to you, as the Lord said to Sarah, and Elisha said to the Shunammite woman, that about this time next year, you shall bear a son. Assisted reproductive technology is saying to any woman, any man, any couple with infertility, that about this time next year, you shall carry your child. Amen? So assisted reproduction, today all over the world, we say that about 13 to 17 million, if you look at the literature, from 1978, when the first was delivered till today, about 13 to 17 million babies worldwide have been delivered through assisted reproductive technology. The first in Anambra State, by a center in Anambra State, happened on the 6th of August 2011. So we joined the global map, and that was Baby Joseph. By Joseph, again by Ike Chebela and his team at Life Specialist Hospital Nnewi. That was the first IVF center in Anambra State. And it was the second in the whole of our southeast Nigeria. The first was Nwofor Hospital at Enugu. There was one at Abaden, M&M, but he closed up and moved to Abuja, so we don't count it again. So the first was Nwofor Hospital in Enugu. followed by Life Specialist Hospital in Anambra State here. And today, let me tell you, we have nearly 10 assisted reproduction centers in only Anambra State. So we are growing, and we'll get to know all of them. Since 2011, that I delivered the first IVF baby at Life Specialist Hospital, I have today delivered a total of 842 IVF babies. This is my own record alone, 842 successful IVF babies born through in vitro fertilization. By the time you add all the hospitals practicing in Anambra State, we are almost hitting up to 2,000 in vitro fertilization babies. And so let me take us through the solutions that assisted reproduction has come to offer us. The first we have is what we call the conventional in vitro fertilization. In the conventional in vitro fertilization, what we do simply is to harvest the sperm, harvest the egg from the woman, fertilize it in a petri dish, keep them in a petri dish in a laboratory, in an incubator. We call it a CO2 incubator, carbon dioxide permeated incubator. And the egg and the sperm will fertilize and form a baby. That baby will remain in incubator for 2 to 5 days. Maximum today is 5 days. And between day 2 and day 5, we transfer that embryo to the womb of the woman. And that is assisted reproduction for you. And when you transfer, you wait for implantation to take place. 2 weeks after, that baby would have planted inside the womb. And if you run a pregnancy test, that pregnancy test will be positive. So the procedure looks so simple and sounds so simple, but a lot of technicalities and technologies and expertise goes through it, and the baby will be delivered. And that's why I want to testify of this solution. The first baby we did in 2011, we called baby Joseph. This was a couple who had their first delivery, and they conceived naturally, and natural conception, but the baby died in the womb because they had obstructed labor. Stayed 4 days in labor, obstructed labor. And by the time the baby was delivered, macerated stillbirth. And subsequently, she could not conceive again. 4 years, they were wandering in the wilderness until they came and we did a laparoscopy. And laparoscopy showed that both tubes were blocked and there was nothing else that could be done. And they were moved to in vitro fertilization. And this happened to be my first IVF patient. In that first cycle, I had 2 patients. And we offered her in vitro fertilization and took her egg. A young lady, she was then about 31 years, took her egg, took the husband's sperm, fertilized it, put it there, and lo and behold, out of the 2 patients I had, she conceived and carried her pregnancy through antenatal period and delivered successfully. And that's the solution that in vitro fertilization can bring. So if a woman has blocked fallopian tubes, that is the person that needs this solution. If the woman is having challenge in one way or the other, we call it uterine synechia, so many things happening in her reproductive cycle. Don't give up. Just know that there is an answer. And that answer is what we are bringing to you today. And look, this looks very simple, but this is the simplest of all assisted reproductive technologies that we deploy to solve infertility challenges. But what of a situation where a man still wants to use his own sperm to achieve a pregnancy? Normal sperm analysis says that you need to have 15 million sperms, at least 50% active motility. And for this man, let me give you another scenario. And this my couple, a 47-year-old nulliparous woman, didn't know what else to do. They have wondered and wondered. 9 years of infertility. They didn't know. This man, when his sperm analysis was done, the sperm count was what? 1.5 million. It is not 15 million, it's just 1.5 million. But then, the motility was, active motility, progressive motility, we call it, was 0. Everything was sluggish. And of course, that is, it could not work. But let me tell you, we gave the man some treatment, some sperm stimulations. It can work sometimes. And sperm count was able to rise to 3 million, but the motility was only 5% active motility. It still could not achieve pregnancy naturally. This same couple had gone ahead to do 2 conventional in vitro fertilization attempts, and they all failed. But there is a technology that has come up, and we call it intracytoplasmic sperm injection. In intracytoplasmic sperm injection, what do? Once a man can boast of 1 motile sperm, you just take it and inject it direct into the egg. This is 1-to-1. So 1 egg, 1 sperm. And that's what intracytoplasmic sperm injection can do, using an ICSI machine. And with this method, this man, we gave him this option. And we treated him and his wife. And let me tell you, lo and behold, 2 embryos, blastocysts, successfully developed. And those 2 were successfully planted into the womb of the woman. And 2 weeks later, the pregnancy test was positive. And of our normal way, 6 weeks after, we do a scan to confirm how many succeeded. And 6 weeks later, a scan was done and a single gestational sac was seen in the uterine cavity. So that was a successful pregnancy. The woman carried it to end and delivered a male child by this time next year. Hello? When I say by this time next year, you have to be responding. And he delivered a child by this time. And that is it. So that's the miracle of assisted reproductive technology. And this man who had given up all hope, who was wandering in the wilderness for 9 years, and whose resources has been depleted, suddenly, by the technology of intracytoplasmic sperm injection, utilized his own little 5% motile sperm to achieve a pregnancy and a delivery. And that is wonderful. Hello? I take you to another level where, look at a category of people. This woman, for one reason or the other, of this man, for one reason or the other, just like Jesus, the Lord said to Sarah, by this time next year, and Sarah laughed, I am old. What of women who are menopausal today? What of women who have delayed childbearing and conception, and they are now in their 40s, in their 50s? Do they still have a chance? Can they still have a child? And that is where even some men who have azoospermia or retrograde ejaculation, or what do we call it again? When you have absence of ejaculation completely, asemia, they ejaculate and nothing comes out. Okay? Do they still have a hope? Yes. This is where we bring in the third-party assisted reproductive technology. The third party in assisted reproductive technology. Today, we have sperm bank, we have egg bank, and you can actually come to the bank and pick up a sperm when you are in need of it. And you can actually come to the egg bank and get eggs donated for you when you are in need of it. Just like you can receive blood donation and your life is on again. Just like you can have a kidney transplant and you receive another kidney and you continue to live. And you can also have, how many things can we not transplant today? And everything is transplantable. So also, we can actually, for this woman who has passed her time and who is no longer ovulating, she can actually receive donated eggs and is fertilized with her husband's sperm. And 2 of them will join together. And that will be an embryo. And let me give you this story of a 55-year-old woman. She's my oldest successful IVF pregnancy today. 55-year-old, menopausal. She thought my own has ended. But because she got married, in her first marriage, she did not have a child. She got divorced because of infertility. She married again. Still, there is no child. And at the end of the day, they came with her husband. The husband is also old. And by the time she was tested, her tubes were also blocked. We just had to test her. And of course, that blocked tube was what kept her all those years. But this time around, she was already menopausal. And her eggs are no longer working. And so we offered her donated eggs and used the husband's sperm to fertilize the eggs. And of course, it formed embryo. And the embryo was transferred into this woman. Of course, in this instance, we transferred 2 embryos to her. And 2 weeks later, confirmed pregnancy test was positive, and a scan was done. And this was her first attempt in vitro fertilization. And she had twin gestation. The pregnancy was followed up, antenatal, and she delivered twin boys, weighing 2.1 kg and 2.5 kg at 34 weeks gestation. Let me tell you, their joy was unparalleled. And the couple gave praises to God. And let me tell you, everything was like the heavens have come down. And so, for this couple, by this time, what? By this time, what? She was carrying 2 male children. And this is fantastic. Somebody who had already gone into menopause. The whole world was already making gesture of her. They say she has married the first time and she didn't succeed. And this man that married her again, they were saying, you went and got a woman who did not bear a child where she was coming from. How do you think that she can perform in this marriage? But God can surprise us in every situation. This couple actually refused the adoption. They weathered all the storms and every other thing. And at the appropriate time, assisted reproductive technology came to them. And things happened. And this is a great joy. Let me tell you another aspect where we have assisted reproductive technology that we can actually say to people who have lost all hope that at this time next year, you can carry your own child. I had this woman who grew up and became a beautiful young lady, and her husband married her. And all she knew when she was talking to us was that every month she will have stains of blood that looked like menses, but nothing flowed. But she continued that way and got married. Of course, this man saw this beautiful lady and married this beautiful lady. By the time laparoscopy was done for her, there was no uterus. Even what she had was a very small rudimentary uterus. Now, she told us the story that she had a laparotomy. And laparotomy, they said it was a rudimentary horn that was not attached even to the vagina. The vagina was blind ending. And in that laparotomy, they removed it because then those that did the laparotomy for her didn't have access to laparoscopy. So they now did laparotomy to find out what was happening inside her. Why wasn't she menstruating? But when she came and we did the laparoscopy again, we found out that it was absent uterus. So for this couple, what will this man do? I want to ask you, if you are the husband, what will you do? And that's actually the challenge these husbands faced. But I'm glad to say that this husband supported the wife and said, this is my wife. It's my choice and I have chosen her. Doctor, can anything be done? And I said to him, good that you're here today. Something can be done. If you can accept surrogacy at this time next year, you shall be a father or a child. And what is surrogacy? Because the only thing that this woman is lacking is a womb. Her ovaries were normal. She was ovulating. And the man was normal. His semen analysis is superb. In short, if he touches somebody once, the person will conceive. And so, what do we have to do here? No, it's not the ordinary touch of mental health. It has to be a gynecological touch. So let us define this. So they were counseled and they accepted to have surrogacy. And of course, we had to look for a surrogate mother. And with a surrogate mother, her eggs were stimulated, harvested, and the husband's sperm were harvested. We fertilized it, got embryos, and the embryos were planted in the womb of this surrogate mother. 2 weeks later, the pregnancy test was positive, and the surrogate mother had an uneventful antenatal care and was delivered of a live female neonate weighing 2.5 kg at 37 weeks of gestation. The couple recorded their baby, or the couple received their baby at that same hour with abundance of tears of joy. And this man could not contain himself. I told him, what you are witnessing today is the power of love. You stood with this woman, you continue to love her, and God honored your love and brought this technology. And this technology has helped you to fulfill your biological role. I want to challenge us, as many of us are hearing my voice today, tell couples, not that you cannot father a child by natural intercourse, by normal sexual intercourse. It's no longer a reason for you to divorce your wife and say, I shall not marry again. Today, this same God who said to Sarah, at this time when? And then this same God that walked through Elisha, and Elisha said to the Shunammite woman, at this time what? Next year you shall bear a son. Has also given medical science the knowledge and the technology that by the power of assisted reproductive technology, we are saying to infertile couples and to women and men who have not been able to achieve natural pregnancy that at this time next year, you shall carry your own child. Let me also say that, yes, we have gone beyond this level and we have gone to other levels. Today, there is fertility preservation and so many things are happening. In area of fertility preservation, we can say, we call it cryopreservation. In cryopreservation, today we can preserve the egg, we can preserve the sperm, we can preserve the embryos. And this is very important now for young people who are going through cancer treatment. Cancer treatment, who are going through chemotherapy. Like you see a girl of 20-something years now, he comes up with malignancy. And this young girl will go through chemotherapy. And going through chemotherapy, the ovarian structures can be damaged. These are embryonic cells and every other thing. And they are potential cells. They divide so quickly, they can be destroyed. But today, you can still go through your chemotherapy. All you need to do is, we can harvest that ovary or harvest the eggs and cryopreserve it for a time when you want to marry. I have so many requests now of couples who have come in this way. Young girls, there is even one I will tell you. Just 3 weeks ago, while I was preparing this lecture, a young lady, 39 years old, came and said, Doctor, I heard about you and I decided to come. That now, I am 39 years and I know that when I get to 40, 41, 42, 43, 40, my ex will not work for me again. That I don't want to marry now because I have a career that I am pursuing and I must exhaust this career. We are talking about career these days now. And so what she asking that, please, can I preserve my eggs so that I know that I'm targeting in the next 5 years that I can settle down with a man, but not now. I must move on with this career. And so these requests are coming today. And will you tell this young girl that no? She says, when I want to have a child, I still want to have a child that will be of my own genetic makeup. And of course, I told her it's possible. We can actually harvest your eggs, preserve your eggs for you, and you can go and continue. When you are ready, come, and you can actually conceive again. This is what is happening in our generation today. So women who are delaying childbearing because of their career and other purposes, and couples who are living apart, it's also happening now. Almost every month I receive requests. Today, because of this diaspora thing and these travel things, and because of restrictions in visa, some husbands are abroad and wives are in Nigeria. Or some wives are abroad, husbands are in Nigeria, and they cannot come together again. But we are offering them cryopreservation. Some husbands, they will produce their sperm there, freeze it, and courier it to us with a cryopreservation tank. And we'll receive the sperm, and the wife will come, and we'll stimulate her and fertilize it with that sperm. And today, they will have their own child. Hello? At this time, what? This is technology, but this is knowledge that God has allowed us as humans to have this knowledge. And the next level that we have gotten to, all these things I'm telling you, they are available in Nigeria. They are available in Anambra State. We are practicing it. We are not telling you things that are just happening abroad. They are already here in Nigeria. And you can access it in all the fertility centers I've mentioned to you that are in Anambra State. And all of us will be better for it. The next one is in Igbo land. And of course in Nigeria. Because we are practicing a patrilineal society, a couple will have a child and they will still be waiting and waiting and waiting. They say there is no male, there is no man, there is no boy to take after me and every other thing. I am very glad that our professor, emeritus professor that we are giving his lecture today, right from the beginning, was different in this kind of mode. But you see this happening, gender selection, that's what is happening today. And so, when there are only females in a family, so many families will think that this is a curse on them. And even their generations, if the man suddenly dies and he's not a very strong man to have divided his properties to his children, what happens? The in-laws and outlaws and even some of these uncles and what else we call them, they will come there and collect everything. Is it not happening? It's happening. And that is why we come up with gender selection today. And families, African homes, everywhere in societies, if you think that what you need to save your life and to save your situation is just to have a male child, it is possible. It is possible. And that's what we do in assisted reproductive technology by the principle of sex selection. And what do? Once the embryo is fertilized, we take a cell from the embryo and do the chromosomal pattern. And of course, you will see whether the chromosomal pattern, whether it's SS or SY, and whichever one you choose, you get it. My first successful sex selection, and this couple, this woman was 41 years old, a civil servant. She was para 6 plus 3. When I say para 6 plus 3, it means that she has had 9 pregnancies, 5 living female children, and still the home was not at peace. And she came and she was referred, and we discussed this and every other thing. She had actually, in her last pregnancy, she conceived, she went and did what we call chorionic villus sampling between 13 and 16 weeks. You can go and sample the placenta bed and check whether it's a male child or a female child. They did it in their last pregnancy, and it came out to be a female child. And that couple terminated that pregnancy. So that's why I say para 6 plus 3. So they have had 3 terminations. But now they came and say, you don't need to go through that route again, but you can go through sex selection by assisted reproductive technology, IVF. And we conducted sex selection for her. She produced about 7 embryos. They were all tested. She had 3 males in it, and the rest were females. And she accepted transfer of those 3 males. And when those 3 males were transferred, this was a very powerful, successful story. Because the woman conceived, and when we did a scan, the 3 embryos all planted, and they were all successful. She carried the pregnancy, and she was delivered of 3 male children. Let me tell you, on the day we did surgery for this woman to deliver these babies, immediately the 3 babies came out. 1, 2, 3. First boy, second boy, third boy. The woman, under spinal anesthesia, started crying in the theater. And do you know the song she was singing? Now, God has settled me in my matrimonial home. Can you imagine? After 9 pregnancies, 5 living female children, and God surprised her with triplets, 3 boys. And so, with my sex selection technology, I've been able to deliver today 1 triplet, 6 twins. 6 twins, that's about 12 plus 1 and plus 8 singleton babies. Those are a total of about 23 babies that we have delivered from 3 males to families to settle challenges. Some of these couples came when they are close to a divorce, when they are close to a separation, or the woman came when they were about to marry another wife to say to her, since your womb cannot produce a boy, let us bring a womb that can produce a boy. But I want to tell you today, by the science of assisted reproductive technology, that same womb can also produce a boy. Hello? Are we following? And finally, there is the list of our technologies, but I must mention it. For those who think that all hope is lost, we call it intrauterine insemination. When, even if a husband has azoospermia and he cannot do anything today, by the use of donor insemination or insemination with the husband's sperm, even when you have severe obesity or when the man cannot even achieve adequate erection to achieve a penetration and he cannot perform, let me tell you today, your own is not over yet. If you still, instead of the traditional Igbo way, do you know there is a traditional Igbo way of solving this problem? What do? They will tell the woman to toyari opa. Yeah, okay. Hello, am I communicating? So, which means that the woman will have to, sometimes they will even arrange it. That a special person will come, the man will leave his house and say he has traveled. And something happens in the house, and the man will pretend I don't know about it. Ladies and gentlemen, today, by the principle of assisted reproductive technology, you don't need to, even with this HIV and every other thing, all the woman will need to do is to, if the woman is normal and the man has the problem, this is the solution for male infertility. Just bring your wife. All we need to do is to do intrauterine insemination with your own sperm if it's available. If it's not available, with a donor sperm. And I tell you, they will conceive. In one of the studies we did, when we analyzed all the people we have done artificial insemination for, we achieved pregnancy rate of between 40 and 60%. And today it's even more. With artificial insemination, we are hitting success rate of up to 80%. So you don't need to. You don't need to suffer from all the moral consequences. But you can have assisted reproductive technology and you conceive. And let me say, with all these success stories we have mentioned today, what does it mean? Many years of waiting, repeated miscarriages and near miss or fake conceptions. Do you remember that there are so many fake conceptions now? There are people who will say they are doing planting. They do crypto pregnancy. They will tell you there is no other person that will see this pregnancy. Even their own pregnancy, ultrasound cannot see it. I'm telling you that assisted reproductive technology, ultrasound, we see the pregnancy. There are some people who will tell you that no other person can deliver this baby except me, because I'm the only one who is seeing it. Please come. We will plant it in your womb and you carry your pregnancy. You travel abroad and go and deliver and have a citizenship anywhere you want. This is why this is a true technology and not a fake. So, unending prayers and fasting, unlimited medical and spiritual consultations. So many couples have gone through all this. Emotional torture, family and social stigmatization, and of course, huge life expenses. But I tell you, with the success of assisted reproductive technology and the cry of baby, all these tears will be wiped away. And that is the success we bring to you today. And that is the miracle of assisted reproductive technology. But all these are not rosy. There are factors affecting the success. I will just mention them quickly because I'm rounding up. The one is maternal age, which is the strongest predictor of your success in assisted reproductive technology. But I've told you now today we are overcoming that maternal age. That even when you are menopausal, come and you shall still be blessed. Egg and sperm and embryo quality, the cause and the duration of the infertility, the condition of the uterus. There are so many trauma on the uterus of women today. And today, remember, the only natural incubator, the only incubator that is still available is the uterus. What is coming, when I'll tell you a few things about the future of assisted reproductive technology, and you know what is happening. So what do we recommend? We recommend that early and comprehensive evaluation, appropriate treatment of infertile couples, and they will succeed and they will achieve their result. There are also ethical and religious challenges. Next slide. There are also ethical and religious issues. Move. What are those ethical and religious issues? People talk about embryo handling, selection and disposal. What do you do with it? For us, in our ethical practice, we make sure we treat all embryos produced as life. And then we accord embryos the sanctity of life. Preserve it, or you transfer it into a woman so that it can take its course and develop. The use of donor gametes, people question it. Why should somebody donate sperm or egg to some other person? But I mean, why are we still battling with that? When we can donate, we can actually donate heart today. We can donate liver. We can donate a kidney. We can even donate, even transplantation of uterus can happen now. People can donate their uterus and it's transplanted. These things are also happening. And of course, I don't know whether brain is being transplanted now successfully, but JKC imagery will tell us that. So these things are already happening. Surrogacy is also there, and higher order multiple pregnancies. But most religious groups, or some of the religious groups, particularly the churches that stand against assisted reproductive technology, do that because they are considering the sanctity of life, starting from the time of conception. And so, wastage, why do you waste life? And every other time. That's why I say, if you practice assisted reproductive technology, you practice it with conscience, and you practice it with all the ethical disciplines that are there. And keep the embryos, either you preserve or you transfer into a woman. Don't throw away, because they are not meant to be thrown away. And that's why we assure the churches, we assure every religious group that assisted reproductive technology also has ethical boundaries. But you must realize that in everything good that God has created, is it not? There will always be the counterfeit and the destruction that will come from the evil sources and every other part. But because of that, we cannot stop. This technology has saved families. 13 to 17 million babies in this world now came through assisted reproductive technology. And so that is the key, that assisted reproductive technology has brought hope to countless families. And so the practice within ethical boundaries is acceptable, and this is what we will encourage. And all of us will be happy with it. It is actually because of these ethical issues that Robert Edwards, Patrick Steptoe were not given the Nobel Prize until 2010, when Robert Edwards was given the Nobel Prize in medicine and physiology for developing in vitro fertilization. And so the whole world has come to recognize assisted reproductive technology with a Nobel Prize in that area. The man who developed in vitro fertilization received the Nobel Prize in 2010. The challenges for the couple who want to access assisted reproductive technology, the challenges are that of high cost of the treatment. The treatment is still expensive, and in our part of the world, there is no insurance. And access is also limited because there are few centers. I've said in the whole of Anambra State now, we have less than 10 centers. And the whole of Southeast Nigeria, we have less than 15 centers that are practicing assisted reproductive technology. So there are limited centers, there are limited specialists, and the cost is very high. And there is no health insurance in this area. So we appeal to the government and to the health sector to actually provide insurance for fertility care. It will go a long way in saving so many homes and so many families. What is the future of assisted reproductive technology and the advances that we have come to? The first is genetic screening and embryo selection. Today, I just came back from a conference of Embryology Society of European Society of Human Reproduction and Embryology in London. In one of the presentations we had, we are now talking about artificial intelligence in embryology. Today, they use artificial intelligence to analyze the embryo that you can transfer, and we can actually say with degree of certainty that this embryo, with this typing and with these characteristics, were planted in the womb of the woman. This is what assisted artificial intelligence has also brought into assisted reproductive technology. So we are having a fusion of assisted reproductive technology and artificial intelligence now, and is producing a wonderful combination that the success rate in assisted reproductive technology is closing up to 90%. And this is fantastic. I've mentioned about fertility preservation and other things, and the treatment of male infertility. So I challenge you by saying that medicine and assisted reproductive technology are pushing the boundaries that were once thought to be impossible, and they are becoming possible today. And if you know about artificial intelligence now, can we say to the engineering world and to the whole world as a whole, can we roll back artificial intelligence? Can we roll back artificial intelligence? I'm asking us, can we turn back artificial intelligence? No, we cannot, because this is knowledge that God has allowed human beings to have. And in the same way, I know there are people who are still arguing that assisted reproduction should be stopped. Is it possible? That has brought so much joy, so much smile, and so many things. And I want to also challenge you, if you're religious, that in Deuteronomy chapter 29 and verse 29, what did he say? That the secret things belong to the Lord. That the secret things belong to God. But the things that are revealed belong to us and our children forever, that we may follow all the words of the law. So following all the words of the law, the knowledge that is revealed is for us and for our children. Assisted reproductive technology has been revealed and is for us and our children. And by this time next year, your tears will be wiped away. And what is the message to couples with infertility? Do not lose hope. Do not lose hope at all, because assisted reproductive technology has come. Infertility is not the end of the story. It's not a death sentence. It's not a curse. It may be that God is saying to you that He's waiting for a time to use you as a testimony to tell others that assisted reproductive technology can work. Medical science has opened the doors, and we cannot close it again. I challenge you to seek proper evaluation early enough, avoid harmful myths and unqualified treatments, support one another emotionally, and remember that many families once in tears, are now rejoicing because they have received help from assisted reproductive technology. Hello? And I will conclude by saying that assisted reproductive technology is one of the greatest achievements of modern science. It has transformed the despair into celebration. It has transformed silence into laughter. And it has transformed emptiness into family. Houses that were once empty are now rejoicing because there are children. Indeed, for many couples, about this time next year, their tears truly were turned into joy. But I cannot say finally, I cannot say conclude without singing this song with you. And I want you to listen very well to this song. Because when I was preparing this presentation, when I was asked to do this presentation, I was actually in the middle of this lecture or preparing this lecture, and I stumbled upon this song. I said, wow, it means that some other people are also prophesying. And they captured the prophecy of assisted reproductive technology.
There was a woman living in Shunem. People knew her house, people knew her name. She had land, she had wealth, food on the table for everyone there. But inside the home there was still one thing: no son to carry the family name. Her husband now was growing old, and the years kept passing as the story told. One day Elisha came through the town, tired from the journey, sitting down. She looked at her husband and quietly said, that man of God should be cared for and fed. So they made a room upon the wall, a bed, a table, a lamp and all, a chair for resting after the road, a place for the servant of God. And every time he passed that way, he stopped in that upper room to stay. She gave with kindness, not for gain, never complaining, never demanding. Then Elisha called her near. Tell me, woman, why all this care? Can I speak for you to the king? What is the one thing that can be done? She answered calmly, standing there, I have a home among my own people. But Gehazi whispered what nobody said. She has no son, and her husband is old. Elisha looked and called once more. She stood there waiting by the door. Then the prophet spoke words strong and clear. About this time next year, about this time next year, you will hold a baby in your arms. About this time next year, God will turn your pain to songs. About this time next year, you will pass the exams you feared. About this time next year, the doors will open wide and clear. About this time next year, you will find the job you prayed for. About this time next year, you will stand healed and restored. About this time next year, you will meet the right life partner. About this time next year, the family will come together. About this time next year, you will walk into your new home. About this time next year, you will no longer fight alone. About this time next year, the business will finally grow. About this time next year, you will reap what you did sow. About this time next year, the papers will finally come through. About this time next year, you'll smile at what God can do. About this time next year, your travel will be successful. About this time next year, new doors will open before you. About this time next year, your immigration issues will be solved. About this time next year, your status will finally change. About
Thank you
this.
so much. And finally, every child born through assisted reproductive technology is not merely a scientific success. It is a testimony of hope. It's a testimony of perseverance. and the triumph of human compassion and innovation. At about this time next year, your tears shall be turned to joy. God bless you for listening.
A round of applause. Our former acting vice chancellor, our own former digital dean, the man who has seen it all in the field of assisted reproductive therapy, our own Professor Joseph Ifeanyi Ikechebelu. Thank you so much, Prof, for all you do. Thank you so much. Infertility is no more a cause. Our medical science has actually solved a lot of problems. He is a pioneer, and it's a deep pleasure to thank you for all you do. Orderly, now that you're pursuing your career, you should be saving something. Distinguished colleagues have been instructed by the chairman to let you know that the applause for our guest lecturer is not enough. Please let us give him what he deserves. Let us give him all that he deserves. He knows it. He has done it. He has proven it beyond doubt. Thank you so much. Distinguished colleagues, ladies and gentlemen, while the presentation was going on, the Vice Chancellor of Nnamdi Azikiwe University, our own Professor Bond Ugochukwu Anyehi, walked in. Please, shall we recognize the presence of the Vice Chancellor of Nnamdi Azikiwe University, Professor Bond Ugochukwu Anyehi. VC, it's a pleasure to have you in our midst, and is one of the award recipients for today's event. And also here we have in our midst distinguished colleagues, ladies and gentlemen, our own provost, our own mentor in the field of neurosurgery, the man who leads and we follow, the Baba Diaya, the Methuselah Chifo, Professor Jude Kennedy C. Emejulu. And also in our midst is our former provost, former commissioner for health, Anambra State, the 4-in-1, Professor J.I.B. Adimma. Igirigi Udo, Igirigi Ebumpu, Igirigi Ifeanyi Chukwu, and the wife, Emeritus Professor J.I.B. Adimma. Thank you so much for all you do, Prof. And also we have in our midst our own immediate past CMAC of Nnamdi Azikiwe University Teaching Hospital. He came in with a wife, Professor Ogo Ezejiofo. The CMAC Giganticus. He's one of the tallest CMACs in this part of the world. He has magnitude, he has direction. He is coming. Please, a round of applause. I welcome our own former indefatigable CMAC. Thank you so much for all you do, Prof. Thank you so much. Then we have in our midst our own Dean of Medicine. He came in with the Vice Chancellor, Professor Ike Mbachu. I will now hand over the mic to the chairman of today's occasion for us to formally appreciate our guest lecturer.
Ladies and gentlemen, standing on the existing protocol, you will all agree with me that we've been fed academically as well as socially by the guest lecture. And then we have this presentation to make to appreciate him. So, Professor Jai Kechebe, can we? This is a token of appreciation from the Nigerian Medical Association, Anambra State, in recognition for your excellent delivery of the 6th Emeritus Professor Festus Aghagbo Nwako Memorial Lecture this day, 17 July 2026. Congratulations. The MC, we should take few goodwill messages before we go into the next.
Distinguished colleagues, ladies and gentlemen, with the kind approval of the chairman of today's occasion, may I invite Igwe Nejoka, the oldest monarch, Igwe K.O.N. Orizu, ably represented by Prince Obianefo Orizu, for the goodwill message, for the fatherly blessings, for all the royal blessings.
The chairman of the occasion, my vice chancellor, the chairman of the Anambra State NMA, my former CMD, Amekene, the guest speaker for today, Professor Ikechebel, JKC, I agree. Dr. Rick, my greetings to everybody. Let me stand on the protocols already established. I stand here on behalf of His Royal Highness, the Igwe of Nnewi, to appreciate the Nigerian Medical Association Anambra State for the wonderful things this association have been doing. The lecture today is an eye-opener, and I'm glad that I'm here to listen to this lecture. This is to wish you the best of luck and to say that the remainder of the activities you have will go smoothly, that God will bless each and every one of you, and that at the end of the day, we all go home happy, satisfied, and in God's care. I would have started by welcoming everybody to Nnewi, but let me all now say that Nnewi is a land that is so clear and so open to visitors. We are called the land of gold, and we bless everybody who come into Nnewi with a clean heart. Everything good that you have in your mind when you enter Nnewi will blossom. Thank you, and may God bless all of us in Jesus' name.
Igwe Nejoka, thank you so much for all you do. Distinguished colleagues, ladies and gentlemen, we have in our midst the only person that whenever we see him, he represents 4 people from the Nnewi kingdom. Igrigi, Ifeanyi Chukwu, Igrigi Udo, Igrigi Ebunkpu, Igrigi Muta. Shall I invite Professor Joseph Ifeanyi Brian D. Adimma for his goodwill message? Makonda for Nwako life. Under Analia power directly. 9 we're losing dilute. Igrigi.
Abacha. Chairman, Professor Zanda Nwofor. Chairman NMA, Dr. Kam. Our distinguished Vice Chancellor here present, Professor Bond Anyehe. I want to recognize Dr. Ada Nwako. I salute you, man. I want to recognize all the men and women of distinction here present while standing on existing protocol. I did not know that I was going to be called out to give a goodwill message. But I think it is only proper. Professor Festus Nwako, whose memorial lecture has just been finished by no less a person than our indefatigable Professor J.I. Ikechebelu. Is a man that if you ever encountered, I mean Professor Festus Nwako, if you ever encountered him, you would never be the same again. He's one man that when you listen to him once, you will always want to listen to him again and again and again. And you want to aspire to be like him. Well, the passing of Professor Nwako, Emeritus Professor Nwako, simply tells us that every good thing that ever exists in this world will come to pass. Even as a first-year clinical student, I started encountering Professor Nwako. Up to the time I became the Dean of Medicine, and so on. I want to congratulate the Nigerian Medical Association for keeping the flag of this memorial lecture flying up till today. I was part of the very first Festus Nwako Memorial Lecture. In fact, the then chairman of Anambra NMA, then Dr. Joseph Odili Ubaja, had visited Dr. Nwako, Professor Nwako, to take permission to start a lecture in his honor while he was alive. Incidentally, Professor Nwako died before the very first lecture. So it became converted into a memorial lecture. I gave the second. There were 2 lectures on that day. Late Emeritus Professor O.O. Mbonu gave the very first lecture. I gave the second lecture of that day, which hinged on sustainable development goals. And I'm glad that the Almighty God has kept me alive today to be able to witness the 6th of this lecture. I'm also happy that running along the footsteps of Emeritus Professor Nwako, I have also become an Emeritus Professor. Oh, Gwabafa. Everybody here has potentials. We are all doctors and we have aspirations and goals. And it is my sincere wish that all of us here will ultimately achieve our aspirations and goals. That had always been the prayer of Professor Festus Nwako when he was alive, when he was the first Vice Chancellor of Nnamdi Azikiwe University, and when he ultimately retired, became an Emeritus Professor, and mentored a lot of us who are old and sitting here. We had gone through him. And we thank God for all of us who are here. I particularly thank our eminent Vice Chancellor, Professor Anyehe, who have found time to be here. As a matter of fact, this is about the first time I'm seeing the Vice Chancellor gracing our occasion. I want to thank you, Professor Bond, for being here with us. It shows the relationship between the university and the Nigerian Medical Association, the doctors in Anambra State. Well, I want to end this goodwill message by stating one of the key statements of Professor Festus Nwako. Professor Festus Nwako says that speeches should be made in proportion to the size of the speaker. And as you well know, I'm not a particularly sizable person, so my speech should be short. And that is why I have made it short. And on that note, let me congratulate NMA Anambra for this wonderful, wonderful event. Thank you, distinguished ladies and gentlemen.
Thank you so much. We deeply appreciate Professor J.I.B. Adima for that speech. Finally, may we invite the lady we used to hear her name while Professor Nwofor consults in the clinic. We want her to come and give the family's appreciation to the wonderful event of today. Dr. Ada Ziba Nwako.
Good afternoon. Good afternoon. My name is Dr. Adora Ziba Nwako, aka Emeritus Ada, as baptized by Professor Okembono of blessed memory. All new and existing protocols observed. As my beloved dad, Professor Festus Aghagbo Nwako, Obatobie Unizik, would say, and as Professor Adima reminded us just now, I will try to keep my speech as short as my height. I am truly honored and humbled to stand here before you, representing the Nwako Nobi family of Rumpi village, Adabo Orofia, Abagana, in Njikoka local government area. And to be able to extend our gratitude to each and every one of you here at the 6th Emeritus Professor Festus Aghagbo Nwako Memorial Lecture. At least, I hope that is where you intended to be today. And if so, you're in the right place, so welcome. I recall that I attended the very first memorial lecture back in 2014 and really highly commend the Nigerian Medical Association, Anambra State chapter for your resilience, your consistency, your foresight, and excellence in keeping the lecture series going. These are some of the values that my dad also held dear and he lived by. Congratulations to the chairpersons and officials of the local organizing committee and all the delegates on achieving a successful AGM and scientific conference when it gets here. My family was especially glad to discover that it was Professor Joseph Ikechebelu, our very own brother, and Abaganas, permits me to use a bit of Yoruba accent, son of the soil, Abagana's son of the soil, that would give today's lecture. Thank you very much, Prof. Thank you. We also appreciate Professor Zanda Nwofor for expertly chairing the memorial lecture today. Prof, may the good Lord bless and keep you for us. You say, a sincere thanks to everyone who has kept in touch with us since the passing on to glory of my dad 12 years ago, as well as the care and support you have accorded the Nwako family. And I want to especially thank my brother, Professor Nwofor. Thank you, Prof. May you and all your families receive abundant blessings from Almighty God. Amen. NMA, Anambra State chapter. We are part of you, just as you are part of us. Was the successful legal registration of his legacy, the Professor Festus Nwako Foundation. I remember we launched it at Nnamdi Azikiwe University a few years ago. The foundation works with and supports children and youths through health, education, and sports, the three areas that he was so passionate about. And I must say, if you're an Arsenal, if you're a Gunner, Arsenal for life, right? If you're a Gunner, Gunners for life. He said no. We are Gunners for life. That's it. Arsenal football team. We won the Premier League this year, so don't forget. The foundation, as I said, works with children and youths through HES, health, education, and sports. Those were the three areas that Prof was passionate about. So all the proceeds from the lodge, the Professor Festus Nwako Lodge, are used towards the work of his foundation. And if you want to find out more, please search for Professor Festus Nwako Foundation on any social media platform. Follow us there, contact us via email, telephone, or WhatsApp. Finally, I was very impressed when I saw the physicians here today and they stood up and recited their physician's pledge, the Geneva Physician's Pledge. And so I want to exhort you to remember this pledge as you go about your duties as a physician, as a medical personnel. And our prayer for you today is that as you continue to honor our father, Professor Nwako, in your own daily endeavors and service to humanity, in saving lives, in restoring health, may your own Heavenly Father grant you his divine wisdom, his grace, and his loving presence. It's not easy to be a physician, it's not easy to be a doctor, but I know that God has endowed you with that, his wisdom. And as Prof used to say, Professor Nwako also used to say, that there's no profession on earth, I'm sure some of you might remember him saying this, there's no profession on earth that God blesses more than medical doctors. He used to use that phrase in Igbo, that there's a phrase called Chukwuka Dibia. Nobody ever says Chukwuka lawyer, Chukwuka engineer. It's always Chukwuka Dibia. So please don't forget it and do well to respond to the wisdom of God as he gives and grants it to you. May the Lord sustain you and provide for you. In Jesus' name, amen. Unto the Lord be all the glory. Again, thank you very much. And as Professor Nwako again used to say, well done.
Thank you so much, Emeritus Ada. Thank you so much. I was just discussing with Professor Ugu. Everybody has said a lot of things about Professor Nwofor. I mean, Emeritus Professor Nwako. But nobody has bothered to remind us that he's the only person that knows that wherever he is, there is no other professor. How many kilometers apart, Prof? 10 kilometers, no other professor. Thank you so much. With the permission of our chairman, may I invite the NAUT representative, 5 minutes, to come and give us Vision 2030, the new NAUT, 5 minutes. Dr. Dubem Onyejiaka.
All right. Thank you very much. The chairman, Professor Zander, Chairman Anambra State, our own VC. Yeah, you've become the most, the VC would have visited Nayut and Nnewi. Thank you very much for coming. The guest lecturer, the Alert CMD is here. Otugo Nnewi, I have to recognize you. And my elders and teachers, Professor Gochuku, Professor Digwe, the Crown Prince, our own CMD, represented by Dr. Deli. Thank you very much. Okulokana Youth, I can't miss you. The Capone is also here. Thank you very much. Igrigudo, I have to go straight to this presentation. This is just a clip of the making of New Nights. Having the NMA in Anambra State here in this scientific conference is very needful for us to share this insights. To remind us again, the Vision 2030 of NIUT that has to do with ranking among the top 3 hospitals in Nigeria by 2030. That's our mission. There's a 10-year strategic development plan. It has 9 thematic pillars, and there's a capacity for 5,000 beds. We were about less than 600 beds when we were in term site, and it was interesting to know that at this point we're up to 1,800, and we're heading to 5,000. I need to just explain this slide. I have a lot of slides, but this is the core thing of what is driving the new NIUT. We have the strategic corporate governance, and that's what the CMD has done. You must set the pace, the human capacity and the human resources to drive this change. And we came to a point where we had about 6-7 DC marks just to be able to cover every ground. We had infrastructural development, and that's where we are running so much. There's actually so much that is being done at the permanent site, modern equipment and processes, strategic human capital development. Some of our staff are in India, they're in Abuja. They are being trained to become more specialists, even in what we are doing. Partnership and collaboration is very good. Nnewi has done so much in that partnership, helping the new youth, and also robust financial management. The ICT and e-medicine is key for modern medicine, and that's where we are in terms of our EMR. And we have the staff welfare motivation. The motivation is there for the staff to be able to bring out their best, and also on the research. It all started at the beginning when the appointment was made, and the CMD decided to draw up a robust, strong corporate governance that can be able to drive this new NIUT. For this presentation, I may just want to rely on infrastructural development for now because I don't have much time. For some of us that knew the term site, Professor Gochuku, that happens to be the picture of the children emergency. Dilapidated facilities, the medical ward as at that time, and even emergency. By the time we came to the permanent site, many thanks to our last CMD who did so well in trying to give us a space and maintain that space. That was how the permanent site was at the time the new NIUT was being developed there. It was just a walkway. And if you take the area view, you can see it was just a landmass. So much needs to be done. And we went, you can see at this point, some buildings have started coming up. And the gates at the entrance needed to be renovated to give it a facelift. That's the night view of that entrance. That's the where we are at the moment. We needed structures to kick up with what we are doing in terms of clinical service delivery, in terms of giving this service to our vulnerable patients. That's the multi-specialist clinic. That's also the aerial view. I'm going to be able to be a bit fast to be able to capture what I wanted to do. The emergency, of course, we just tried to renovate the one at the term site, but you can see the emergency now for the emergency medical complex. That's the pediatric emergency complex at the moment. That's the GOPD. This infrastructural development is to give NIUT the platform to be able to generate the services for our vulnerable patients. There's a whole lot. That's the 20 theater suites that is going to capture several surgeries that is going to take place at the same time. That's also the modern child zone with the Briggs Avenue and the new intensive care unit. I'm going to run to actually highlight the key areas I wanted to talk about in this presentation. Even the Igbo ICT Center is here. We are moving even to a 1,000 capacity conference hall that is going to be more accommodating for us. There's an international sports complex that's also going to be there at the new NIUT. That's the administrative block where we're about to move in at that place at this point in time. That is the area view at where we are, if you can remember how we were at that just landscape. But so much has been done at that point. Even in the equipment, which is part of the strategic pillars, so much. That's a mobile X-ray, is currently at the ICU. Yes, then also the facilities for the laboratory. So many is actually being done. We have a Nayut Simon program. That's a program that the CMD signed an MOU. If you have any patient that has an obstetric emergency, actually can come to Nayut and is treated for free. We've been doing that since last year, May, and we'll have close to 1,000 women and babies that have been treated free of charge and they went home without payment. This is a very pathetic story. The mother of this baby had premature rupture of membrane. They mentioned about cesarean section. The father rushed to the office to get some money for the surgery, but ended up stealing the money from their office. The boss kicked him inside the jail. The woman ran to Nayut. They had that surgery. Preterm, was nursed for about 2 months. As at the time of this discharge, the father was still in the prison. But because of CMONC, they were able to be taken care of. I want to emphasize part of the infrastructural development in Nayut is the new 1.5 Tesla MRI, which has been installed. These are part of the installation processes. This was courtesy of NMPC Foundation, which was commissioned in June 2026. And this is 1.5 Tesla. It's quite clear in terms of what it can be able to achieve, the clear vision and the pictures you can be able to get. And we're trying to scale up on what we can do. The essence of this MRI is to make sure that everybody that is in Anambra State that is environment can be able to have access to this diagnostics tool. As a matter of fact, as small as 50,000 for patients in NHIS can actually get this sorted out at the Nnamdi Azikiwe University Teaching Hospital. We have so much happening actually in terms of infrastructural development. But we wanted to emphasize that this MRI is key, is available. We are wrapping up these logistics around it, and we feel that NMA and members of NMA in Anambra State should be aware that this MRI is ongoing and to be able to avail the services of MRI in Nayut. We've done all this. There are still some challenges in terms of power. Even the MRI has to be powered 24 hours. But with God helping the team at Nayut, we've been able to do quite a lot in scaling up services and optimal service delivery in Nayut. Thank you very much for listening. Thank you.
Please, a round of applause. Thank you so much. That Vision 2030, the new Nayut. The book is moving around too. Distinguished colleagues, ladies and gentlemen, with the approval of the chairman of today's occasion, may I quickly invite the Onco Clinics, 5 minutes, before we move into the awards proper. Onco Clinics.
Okay. Good afternoon, everybody. Standing on existing protocols because there's no time. I am Dr. Shiwobi Nnoma, consultant radiation and clinical oncologist from University of Nigerian Teaching Hospital Multidisciplinary Center in partnership with Onco Clinics Africa. So today, in line with the discussion of the theme, that is the future of medicine in Nigeria, I'm here to discuss how Onco Clinics is going about the future of oncology in Nigeria. So the current reality is that there is rising cancer incidence in Nigeria. We usually see our new patients every Monday. And I tell you, we hardly ever have any Monday that we have less than 20 new referrals. And imagine that in a month. So the incidence of cancer in Nigeria is really rising. And there's a lot of late presentations. Then having late presentations implies that these people will at one point in time need radiation therapy, because cancer advances, you can't only end with surgery. It has to be a multidisciplinary treatment. And with the radiation therapy, we know that access to radiotherapy centers in Nigeria is very limited. So what has oncoclinics done in Nigeria? Now we are managing a lot of centers. We have So oncoclinics has provided services in Nigeria through establishing partnership with already existing systems and then providing the technology. So for us to come into any place, the place has to already have an oncology center existing, for which that we can now provide the technology, because we know most times government is not willing to fund a radiation therapy center because of the cost of the machines, bringing it and then running the system. So in any place that you have the oncology system already existent, then oncoclinics comes there to partner with it. And we have done this in centers like Sokoto, up north, and then in Katsina. And then down here, we have UNTH and Ebonyi. And also Edo in the southern part of Nigeria has started about a month ago. So what's our impact? We have a total of 5 centers we are managing, and with over 2,500 patients that have been treated, and greater than 71% of cancer treatments, post-treatment with survival. And then we also have a less than 7 days waiting time to treatment, and over 200 clinical staff. So we offer comprehensive care, which includes radiation therapy, brachytherapy, chemotherapy, palliative care, and also expert consultations. So it's really a complete care. And we have the latest machine, leading accelerator, which offers very conformal delivery treatments with the aim of targeting only the tumor with very reduced side effects. We can move to the next. Now, what do we try to do? We try as much as possible to make it affordable. Like before things became really bad and the fuel became, as in the prices of fuel came up, we used to treat pediatric patients for free. But you know, the machine has a thyratron that cannot be put off. So our system is constantly running on light supplies because the linear accelerator cannot go off. So because of that and the recent cost of fuel, we now brought down the treatment for pediatrics to 50%. But apart from that, all the other centers, I think oncoclinic still offers the cheapest compared to MedSafe, Lutz, and other centers, other private cancer centers like Marcel Roots in Lagos. And we also have a complete oncology care, which includes palliative care system, patient navigation system, where we don't leave these patients only to themselves and their diseases. We have clinical psychologists and all that follow up our patients, even post-care. And what do we want? What's the way forward? We want to partner with you people from Anambra State. And we want early referrals to our center because we'll offer you multidisciplinary care. And we can also partner with you in the care of that patient, for which we'll carry you along as the patient is being treated. And after treatment, they are referred back to you for follow-up care. We also engaged in continuous medical education for our clinical staffs, which include therapy radiographers and then medical physicists. And we are also engaged in research for people who have research things to publish on cancer cases. You can always get data from us. So we really, really want after this conference to be able to have referrals and early referrals coming from Anambra State. Thank you.
Thank you so much, the oncoclinics. Distinguished colleagues, ladies and gentlemen, with a kind approval once more from the chairman of today's occasion, I will invite the Fitzen group 5 minutes. 5 minutes for the Fitzen group. Welcome.
Yeah. Good afternoon, distinguished chairman and members of the high table. Good afternoon, consultants and doctors here present. So my name is Jumbo Bright. I'm a rep with Fiston Healthcare PLC, and I'm my colleague here, Solomon Udwe. So briefly, we'll be here to discuss on you the benefit of Astifa Z, which is enhancing postpartum recovery. Okay, so briefly, I want to introduce my company. My company is Fiston Healthcare PLC, as I earlier stated. We are an indigenous company and industry leader in the manufacturing and marketing of fast-moving consumer goods and basically all healthcare medications that we commonly use in Nigerian markets today. We are ISO certified, having the WHO standard lab, and also because of your continuous prescriptions, we are tested and trusted. So my colleague will briefly take over the presentation, and this is an outline here. I'll be guided with him.
Okay, good afternoon, everyone. Permit me to stand on the already established protocol. So we want to talk about a very important stage in the life of a woman, especially after delivery, the 4th trimester, which is actually the first 6 weeks after delivery. Of course, we know that this is an important stage because the woman's body undergoes maternal changes. For example, the physical change we could involve a uterine evolution, that is the uterus shrink back to its normal stage, and then the hormonal stage, which brings about stabilization of the hormones, and hematologic stage, which concerns us because here there is iron depletion, and this could lead to what is called postpartum anemia. So how can we manage postpartum anemia? But before that, there are factors that contribute to this postpartum anemia. You have a vaginal birth. Normally, there is loss of blood. Even in C-section, there is also loss of blood. This tells us that the loss of blood directly leads to the loss of iron, and then iron storage in forms of ferritin. So how to manage this? We have come up with our unique brand, which most of you know, Astifa. But this particular Astifa, we've added zinc on it, and you all know the importance of iron and zinc, especially in restoration of hemoglobin, and then increasing red blood cells, and as a result, the carrying capacity of oxygen. So the zinc in Astifa is actually added to help with tissue repair and regeneration. So from the stables of Fixing Healthcare PLC, I introduce to you Astifa Z. The zinc is, the Z there is Astifa. So this is to tell you that the important micronutrients that helps the woman in recovering, especially when undergoing delivery, is zinc and iron. So the Astifa is well formulated to contain zinc and iron to help avoid or prevent postpartum anemia. So this is the formulation of Astifa. The iron is chelated with amino acid, which helps in absorption, and these are some of the importance of this formulation. It helps improve bioavailability of iron absorption, and studies have shown that formulation like this actually helps the bioavailability of iron. As you can see in the study, iron amino acid chelate provides more iron to be absorbed than other formulations like the fumarate and sulfate. And this is actually the importance of hemoglobin formation. You can see that the amino acids that are found in Astifa, the glycine, lysine, and then histidine, they all contribute in the formation of hemoglobin, which is helping in increasing the red blood cell mass. Now with this, you can see that the major micronutrients that helps a woman recover very well are iron and zinc. And our Astifa contains iron, while iron supports the production of red blood cells, restore hemoglobin, and then replenish iron stores. The zinc helps support fibroblast proliferation, and then it also supports collagen synthesis, and which helps in the immune system. So with this, Astifa is indicated for postpartum women, and then people that undergo surgery, Astifa is also indicated for them. And the dosage is for adults, you can give 10 mils of Astifa Z twice daily, and then for the capsule, you can give 1 capsule twice daily. With this, we are seeing your commitment, especially in the prescription and recommendation of our product to your patients. Thank you, and God bless.
Thank you. Thank you so much. Distinguished colleagues, ladies and gentlemen, we want to thank the Filton Group. Quickly, may I recognize the presence of Dr. MP Ogbuebu Sr. It's a pleasure to have you in our midst. Then we saw Professor and Dr. Mrs. T.U. Mberi. It's a pleasure to have you. Ebi not the very far. VC never again not very far. It was a hedgehog and I've tried VC. Ebi nigga not your season. T.U. Mberi, it's a pleasure to have you in our midst. Finally, distinguished colleagues, before the presentation of awards, may we invite the FCMB group. 5 minutes only, please.
Good afternoon, everyone. Good afternoon. I hope I am being heard. Good afternoon, everyone. My name is Lady Ifoma Amobi. We are from FCMB, First City Monument Bank. We are here to present some of the products we have that will benefit all the hospitals in Nigeria. Okay, so I listened to Prof talking. When he was talking, he was saying something about technology. But you know, those things we have to do with money. Whenever you talk about technology, you talk about finance. So the bank is here to introduce some products that they have that would think that will benefit the doctors in Anambra State. First of all, we have a health finance. We have working capital finance. We have asset acquisition. In that health finance, we have the one we call quick loan. We can get it under 1 week. Once you have an account with FCMB and you apply, you can get it under 1 week. Then the working capital part of it is about 30 million. You can get up to 30 million depending on your capacity as a doctor. And you can also get up to 50 million in asset acquisition. If you want to buy any hospital equipment that you require to run your hospitals, we can give you up to 50 million within 1 week. Then if you have any equipment that you want to buy above 50 million, 100 million, 200, 1 billion, the bank is there to finance it at a very affordable rate. The working capital is for 1 year, while the asset acquisition is for 2 years. So we'll spread it for you to pay within 2 years. Now, the interest rate for the facility is 26% and is per annum. So you can access this under 1 week if you apply. So we are here to help the new hospitals to buy equipment to run their hospitals. We also have a solar finance. You can power your hospital. We know that most of the things in the hospital, they require light. And because we don't have light in Nigeria, it's very difficult for people to run their hospitals. So we have what we call energy solution that we can help you power your hospitals and you'll be able to run seamlessly. We also have a facility that will assist you to buy a house for your hospitals, maybe residential buildings and all that. And that is by the federal government. The rate is 9.75. It's very affordable and it can run for 10 years for self-employed and then 20 years for salary earners. For doctors that are earning salaries, you can also buy houses in your choice location in Nigeria. Once that property has a C of O, you can buy any property of your choice anywhere around the country. But the maximum amount we can give on that, because it's coming from the federal government, is 100 million. So any property you have, you find that is within 100 million naira range, you can get it from the bank and you pay within 20 years. If you are a salary earner with the government and you pay within 10 years, if you are self-employed, and the rate is 9.75. The federal government brought it out to help people to own houses at affordable rates. So all these solutions we have, our health finance, our easy, we call it Easy Home for the purchase of houses, and we also have a solution, energy solution for your hospitals. We have all these things together. If you have a house and you have power and you have finance to buy equipment, you already have a hospital at ease. So we encourage everybody here to look at our products and see how you can buy into one of those products. I think it's very affordable and it's something that we appreciate. We welcome all of you to FCMB and we look forward to partnering with you. We also can give you personal loan as a doctor. If you are a salary earner, in a government hospital, we can also give you a personal loan. Maybe you want to send your child abroad, you want to go for medical treatment abroad. Everything is available with FCMB. So you can also get up to 50 million as a personal loan with FCMB. So why we are here today is, while you're talking about technology, the bank is here to say, come, we can finance your projects. So that's all we have for you today. If you have any other question, you can also have. Thank you very much, and God bless you.
Thank you so much. FCMB, my bank and I. We are coming. 50 million straight away. Distinguished colleagues, ladies and gentlemen, we are now at that point for presentation of awards for distinguished personalities in our society. If you go to page number 20, we have number 1 in our list. Our own Vice Chancellor, the man who cares so much about us. He's like a bond between Nau and Nnewi. Whenever he's around, we are convinced that something will happen. You can see our provost so happy that the VC is around. You can see the dean so relaxed that the VC is around. And I can see Professor Mberry coming with the wife because the VC is here. Professor Ugu, this is the best place because we have the VC in our midst. And he's happy, he's relaxed. Distinguished colleagues, ladies and gentlemen, may I invite Professor Nwofor Ugu for the brief citation of Professor Ugochukwu Bond Anyehi, the first NMA Merit Award recipient for today.
Thank you. Thank you very much, our dear Master of Ceremony. Ladies and gentlemen, may I seize this opportunity to plead with everyone in this hall to maintain some decorum. Please, those sharing at the back, we need you to maintain some decorum. Gentlemen at the left end, this is a very serious and solemn moment. Can we have some quiet and pay attention upstage? We have very important guests here who probably are coming to visit us for the first time. It may not be a very good marketing strategy if we make our home rowdy. The chairman of today's occasion, Professor A.M. Nwofor, the chairman, NMA Anambra State, Dr. Princess Okam, our dear awardees, the 6th Emeritus Professor Festus Nwako lecturer, our immediate past CMD, Professor Igwebwe, our past provosts, our past deans, the current provost of the College of Health Sciences, Professor J.K.C. Emejulu, the Dean, Faculty of Medicine, the Royal Father of the Day, Igwe K.O.N. Orizu, herein represented by Prince Obianefo Orizu, our CMD, Professor Joseph Odrichukwu Obwaja. I have this opportunity. I also consider it a great privilege. I by no means might be considered to be qualified to stand before you this afternoon not to read a citation because I'm not qualified, but perhaps to introduce our first awardee for the day. I consider it a great luxury that I'm being called upon to make this introduction. May I please request, most respectfully so, that our first awardee, the Vice Chancellor, Nnamdi Azikiwe University, Professor Ugochukwu Bon Stanley Anyehe, be standing. Can we give him a round of applause? In every area, in any way you look at it, in the past few months since his assumption of office, there has been a whole lot of positive changes. And just as his name is, he has become a nexus between the high and mighty, between the lowly and downtrodden, between the junior staff and the senior staff, between the academic and non-academic, between the teaching hospital and the university. And today, there is an extensive, warm hand of friendship, including bonding, whether covalent, but not hydrogen bond, with NMA Anambra State. And that is the man standing before us, Professor Ugochukwu Bon Stanley Anyehe. Professor Ugochukwu Bon Anyehe, MBBS, MSc, MPH, PhD, is a distinguished Nigerian academic, medical doctor, physiologist. He also likes to add clinical measurements and a public health specialist of international repute. He is the 7th substantive vice chancellor of Nnamdi Azikiwe University, Awka, Nigeria, a position he was appointed to on the 16th of November, 2025, coincidentally on his 54th birthday. Can we put our hands together? Professor Anyehe is a renowned scholar, administrator, and a leader known for his remarkable academic achievements and contributions to medical education. He attained the rank of full professor at the age of 41. Please, can we give him a round of applause? Making him one of the Nigerian's youngest professors. His expertise spans medical physiology, clinical measurement, reproductive medicine, health management, and medical education. He is a prolific researcher. Professor Anyehe has authored over 100 publications in peer-reviewed journals, with his work cited over 1,246 times. He has served in various leadership capacities, including Deputy Provost of the College of Medicine, University of Nigeria, Enugu campus, Acting Provost of the College of Medicine, Imo State University, and Pioneer Provost of the College of Medicine, Federal University of Technology, Owerri. He is married to Mrs. Udo Ego Anyehe, and they are blessed with 5 children. Ladies and gentlemen, it's a great honor, it's a pleasure, and for me a luxury to introduce to us our first awardee for the day, Professor Stanley Ugochukwu Anyehe.
May we step out there? Yep. Chairman. I think this is a very powerful and I think the only person qualified to present this is the chairman of NMA Anambra State. Yeah.
Bikonu, a profile Akwukwanusia. I want him to be flanked by his supporters. Obuni for VCI Nanya, Biano Kudolu VC, or Yakusia will receive award. And you kunya kwimi honye kwalo. You kunya kwimi honye kwalo. Because VC Ayakusia, I'm a project. My VC, your boy is loyal. VC nam okokwande biakunyeli adekwa mama. It's my singular honor to present this award to you on behalf of Nnewi Anambra State. Professor Bond. Okay, no, this is not for Bond. Please, can I have... Can I have the award for... This is Ezejo for, please. Can I have... Because Yanum correct the proper award for Bond. Because I cannot be seen to bond improperly. I must bond appropriately. Please, apologies for that. Yes, I want to be sure. As an obstetrician, Prof. Yes, it's my singular honor to present this merit award to Professor Gochukwu Bond Stanley Anyehi in recognition of your outstanding and exemplary contribution to the advancement of healthcare in Anambra State. This day, Friday, 17 July 2026. Congratulations.
Clap now.
Prof, I can use the microphone. Respond though. This organizer, thank you, sir.
My NMA chairman, where are my team? Medical elders, colleagues, and friends who came to share in this award. I have resisted many awards since I came to office because I always ask them, what have I done to give me the award? But this is prestigious because it's coming from my own association. Even if I have not done anything, I'm a medical doctor that became a vice chancellor. So in other words, I deserve it. So I'm elated being honored. And we are brothers and we are partners. And my brother Mbieri wants me to announce of all the whole allowances, I'll start paying for the doctors. But I told them that in the pipeline, very soon, they will get all the allowances that they can get. We've started the enhanced comments, but there are other allowances that are not due to you, but we have agreed in principle that to discourage doctors from japaring, that we should pay it until they tell us to stop. That was what we agreed with the minister. In fact, he said, you know that starting paying the commerce is already illegal and you're already doing it. So since you have started doing it, complete it to the full. So we'll do everything possible to make sure everybody is happy. And I thank all of you for this award. And I value it so much. Incidentally, when I was receiving the award, I said, maybe I should make a donation. I said it will be as if NMA is selling the award. However, I know that you have a building project. I'm also a civil servant who may not be able to announce before you say I paid more than my salary. Incidentally, my salary is smaller than commerce salary. The VC receives less salary than this, my brother here. But I will support the building project. I will whisper to him. And whatever I whisper to him, I don't want it to be a one-off. It's a continuous progress. The most important thing is that during our tenure, we will do everything possible to make sure that NMA has the building they deserve. In fact, the last time we talked about land, I said NMA doesn't belong to the board, but if it's through NAMDA,
NMA can smuggle themselves through NAMDA, which is a university association, and we can give land. And then they can still put NMA and smuggle it the same way we smuggled commerce into Konwas. Thank you very much, and may God bless you.
Thank you.
All right. Prof, oh, whisper go kwa and whisper the Lord. Yes, because you can announce, don't worry about the other things. So, Otugo Nnewi, directly behind me. So, may I get microphone? There's a pass, all right. All right, sir.
Okay. Onye Nnewi si na okwu banego. Yes, I will have to appreciate our able, indefatigable Vice Chancellor Bond and Professor Bond and here. We have not really been close. We are the immediate past CMD of the teaching hospital for Zimbabwe. And we are all civil servants. But I will also do the needful. We have been supporting the NMA right from us personally, and when I was in the office as the chief medical director then. But in the same way, Chairman, I will do something substantial. Don't mind.
Because record keepers, there is something substantial. Okay, hey, as you know, when you go to first. My own mentor and boss, but chairman will occasion. But Prof Nazakol can. Oh, I got you back to him. Bro, what's gonna call it? Professor and Kegadro whisperable.
Okay, I will support VC with 50,000.
Thank you. All right.
I will support our VC and my brother. And then for particularly, when I'm saying this, we should understand what it means. His open door policy. Mbone bahana. Emepe luguzo. Oye kocha educha yodu nkacho iwel ewele nkana acho iwel awopukara gya. Manane emepe uzo. That's the very important thing. So I'm supporting my brother. Me and my wife with the sum of 250,000.
Okay, thank you. Sigma Hopsa Limited, 500,000 naira. Biko Koponaka.
My name is Dr. John Ohiri, the Acting Dean of School of Basic Clinical Sciences, College of Medicine, Futo, and also the Vice Chairman of the Nigerian Medical Association, Imo State. Wow. I came here. I came here for Professor Bondanye here, the Foundation Provost of the College of Medicine, Futo, and now Vice Chancellor, Nnamdi Azikiwe University. He laid the foundation of our medical school and ensured growth in that environment. On behalf of the College of Medicine, Federal University of Technology, Owerri, will support his award with a sum of 100,000 naira.
Thank you, 100,000.
Mommy. Well, I see I'm the only, thank God for being there to help me as the only female around. My name is Professor Bello Gochuku. I'm a pediatrician. I know we're children, so, so I'm going to use my small 20,000 to support my daddy VC. Thank you. Dean.
On behalf of myself, well, I will also give on behalf of faculty, but not from faculty money. So I approve. So it's one with a sum of 50,000 naira.
I think I will just follow suit. Let me reiterate what Mberi just said. This is my 30th year in this university, and I have passed through all the 7 vice chancellors. But this vice chancellor came with a difference. It was so easy for me to see him without appointment. I just gave a call and said, come, without appointment. But I had waited in VC's office before till 6:30 p.m. from 11 in the morning. The door is too open. We thank you very much, and we will always support you. I will use my mighty, because the part of the brain I look at is tiny, and 50,000 should be able to take care of that.
My immediate past CMD code, former commissioner. Even I can get out that.
Because I will not waste time just to support what everybody is saying about the open door policy of our new VC. And the day we went, he was having meeting. I said I should come in. I don't know whether he was wondering whether we were listening to the meeting. He said I should be there. So you're welcome. We are grateful. And for the NM, I think what I've been given is enough now. But on behalf of for the VC, I'm going to give a sum of 100,000 to support.
Akadile, Ngwa, Kuzie.
VC is my brother, and I work in medical center, Unizik. So I am so happy for the award. So Nna supported VC with a sum of 50,000 naira.
Igiligudo, I'm not going to message a microphone. Money to Prof. Alpha. Oh, blessing. Just. I didn't thank you.
I retire, go, man. I come out tired. At least as an emeritus professor of the university, I think I support to VCI with a sum of 100,000 naira.
Igiligudo, thank you so much. CMD is behind me. CMD, every represented. Or 1.5 Tesla MRI. My CMD, sir.
Okay, everybody, my VC and everybody around. Maybe I'll take the message to CM, but I'll do my own here. But I will support my VC with 50. But I'll talk to CMD. I know, you know what the CMD will do. No, 50,000 naira. Thank you.
I'm going to be expecting that from the CMD. Omego Kwankome. Dalunu. Hi. My immediate provost is here. I'm a Mifi.
On behalf of my wife, Professor Ifoma Udigwe, we support the VC. Another award is sum of 100,000 naira.
Thank you. My DC Mark. Watching a no boss. I Aquado VC.
Thank you. Even if you didn't approach me, I would have called for the microphone. And my like itinya kwebani itinya. This obona aga. My VC sir, I'm Dr. Chinekwa Nwako. I want to openly appreciate your leadership. I also want to sincerely appreciate your open door policy. Biko Natu Furoge, I want to support you with a token sum of 20,000 naira. Thank you.
Thank you.
Zediorama. Zediorama Patakanana. Oh, kissing no, or the king on also.
So, Biko, Ejim, can well 100,000 supporters.
I've been up for 100,000. Need up Taniru. Our dean, check for the our dean big. Okuloka, na. Quite make a size again.
Not my VC and everybody. I'm disproportionate to my height and my size. Inversely proportional. That's what it should be. It's okay.
I will support my Vice Chancellor with more 50,000 naira.
Thank you. Finally, the man on suit, please introduce yourself.
My name is Honorable Barrister Dr. Ifat Nwokej, the tallest legislator in Anambra State. I firmly accepted all that was said by Dr. Ike Echebelu, but I have one salient objection to it. The salient objection is that he said, what we do have is Chukwu Kadibia. Okay? And somebody said that they were Chukwu ka lawyer. So, or does it mean that the lawyer ka Chukwu? That's my question. Invariably, the other way around. So my VC is the person we came for today. One or two things, he's my brother. I am from Idato. And incidentally, I was in law school with his cousin, Nanda here. Whatever anybody can do cannot change that. It has come to be. So I want to support my brother with a sum of 50,000 naira.
Please, we appreciate all donors. My VC, thank you for drawing this crowd. Please, we'll excuse you at this moment. Please, the VC has whispered to me, and I will announce the whisper because they're a loud one. He's supporting us with the sum of 500,000 naira. Please, a hand of applause to our amiable VC, the first of his kind. Thank you, my VC, even as he takes his leave.
Thank you, thank you, thank you. Okay. We shall continue with the second award.
Distinguished colleagues, ladies and gentlemen, Dubemonye Jiaka. Dubemonye Jiaka, you did not support your brother. Dubemonye Jiaka. Ladies and gentlemen, let's please, let's prepare for the next award. Okay. Herald Choir. Herald Choir, can you calm our nerves while Mojega people are getting set? Herald Choir, are you good to go? Herald Choir, are you good to go? Herald Choir. Distinguished ladies and gentlemen, please, we have in our midst the CMD of Chukwuemeka Odumegwu Ojukwu University Teaching Hospital. She's one of the award recipients for today. Shall we invite to the stage our own Dr. Mori Umakwe Wulu? Please, a round of applause as the CMD of COUT goes up to the stage to take her position. For today's event is the distinguished and the second award recipient for the NMA event of today, CMD COUT, Dr. Mrs. Maureen Umakwewulu, a distinguished obstetrician and gynecologist. Thank you so much for all you do. It's a pleasure to have you in our midst. Thank you. Ladies and gentlemen, may I quickly hand over the mic to the Herald Choir.
can see the colors of the rainbow. I can feel the sun on my face.
All right. As an Afudimba, Afogonogimie, Oploka one, Nana Youth. When I saw your wife's display status, I remembered and can assume what happened. Those olden days. Now I can imagine what was happening those years. Professor Ejejokfor Ogochukwu Fine. I am not qualified to read your citation, but I will want to take this as a privilege. He is a Nigerian physician, dermatologist, academic, healthcare administrator. I want to let you know that he's the first professor of dermatology at Nnamdi University, Awka, having attained the rank of professor in 2022. He began his academic journey at New Bethel Secondary School in Sulu, in Urumba South local government area of Anambra State, where he served as senior prefect and graduated with the best result in his class in 1991. In 1992, he gained admission directly into University of Benin to study medicine and surgery. Following 2 years of interruptions caused by the prolonged ASU strike, he graduated in 2000. Professor Nwofor completed his internship at Nnamdi University Teaching Hospital of Nnewi before undertaking the mandatory NYSC. The NYSC took place in Kogi State. He subsequently went and worked at the Sokoto State Specialist Hospital before commencing the residency training program at Obafemi Awolowo University Hospital. He became a fellow of the National Postgraduate Medical College in Nigeria for internal medicine, completed his residency in 2011. He actually declined lecturership at Obafemi Awolowo University, but accepted wholeheartedly the appointment of honorary consultant physician here at Nnamdi University Teaching Hospital. He was driven by passion for cosmetic and procedural dermatologist. He undertook advanced exposure in Ludwig Maximilian Hospital at Munich in Germany, one of Europe's foremost dermatology centers. You won't even know that he's a dermatologist, but he's a very good one at that. He further enhanced his expertise through specialized training in procedural, surgical, and aesthetic dermatology. At Nnamdi University Teaching Hospital, Professor Ejejokfor played a transformative role in developing the dermatology unit from the early stage into a vibrant center for specialist training and patient care. He was just there, running the system. Through his mentorship, 3 dermatologists have successfully completed their training. Can we give him a round of applause, please? Yes. Improving the access of dermatological services within Anambra State and beyond. The unit also provided the foundation for the training of specialists in rheumatology and infectious diseases. As the head of the dermatology unit, he successfully led the accreditation team of the National Postgraduate College and the West African College. Professor Nwofor has made substantial contributions to teaching, research, and university administration. His leadership extends to hospital administration. Even in 2019, he was appointed the DCMAC of Nnamdi University Teaching Hospital, and he served until 2022. He was subsequently appointed the CMAC until from April 2022, a position which directly the clinical service, the research and training until the completion of its tenure and final in April 2026. With so much loyalty, so much humility, so much dexterity, pragmatism, he delivered the Clinical Service Directorate. During his tenure as Chairman Medical Advisory Committee and under the leadership of the Chief Medical Director, Professor Joseph Obaja, OON, the hospital experienced remarkable transformation. Major administrative achievements included relocation to the permanent site, expansion of clinical services, enhancement of radiodiagnostic and pharmaceutical services, full implementation of the EMR, and digitization of the key hospital processes. Join me, please, to welcome Professor Nwofor, whose career reflects an enduring commitment to excellence in clinical practice, medical education, specialist training, research, and welfare. Ladies and gentlemen, I present to you Professor Nwofor Ogochukwu. A round of applause for him, please, as he receives this prestigious award from Nnewi, Anambra State. Bikono anakokwa na aka ebe a.
His shoes are too big to be filled. Too big. And all they go up to you, feel your big shoes.
May I invite Dr. Ekwesi, past chairman, Nnewi, to join us.
I don't believe Naiha was also here and our support to Nwofor. His support should be proportionate to his size. Please. Support should be proportionate to his size. He's a good man. So please, let's support him and stand by him. Okay. We want to hand the award over to a past state chairman to do justice to this award. On behalf of all the past state chairman, recognition of your contribution and sacrifices to Nnewi, Anambra State. Eto Dikenazia, over to you.
Thank you very much. The chairman of the occasion, Professor Zanda, my mentor in NMA affairs. When you were the state chairman, I was PRO, Ehala Zone. The state chairman, Ozoma, and permit me to stand on the existing protocols. It is my pleasure to present this beautiful plaque to a distinguished professor, Professor Ogochukwu Ifeanyi Nwofor, for recognizing all the qualities as were read out, recognizing all the qualities. And I want to join others in congratulating you and your family. The much you have done, they are much, but we are expecting more from you. In the field of medicine, in any activities, and others. Congratulations.
Okay, Okoloka, agwazi anyị obele okwu ka m wee welu microphone go around. Daalụ, thank you.
Thank you very much, the leadership of Nigerian Medical Association Anambra State, for this honor. I was not expecting this. The leadership knew what they saw, to decide that I should be part of this honor and award today. I sincerely thank you for this. I want to say that this award particularly is not for me alone. I see it as an award for excellence in the hospital, for clinical services and leadership of the hospital. Particularly, the gain we made in clinical services, we made as a team. And incidentally, that team is present here. The team of Deputy CMAX who worked with me at clinical services, we all made that gain together. They came in and they put up the garment of spirit of teamwork, and we worked and made a modest achievement as a team. I want to thank all of them, for being part of this success story today. I also want to thank in absentia the Chief Medical Director who gave me the opportunity to serve under his leadership. That service was a major learning curve. It was a difficult terrain, but I think I learned a lot navigating that terrain, and I'm very grateful for that opportunity to serve under him. I became a better person serving under that terrain. I also want to thank the past Chief Medical Director, Professor Aghagbo, who is here. He brought me into the NIUT management as a Deputy CMAC. Thank you, sir. I didn't go to lobby him personally. I didn't know what he saw in me, that made him decide that I was going to serve with him as a Deputy CMAC. I also knew some members of my department who are here, Professor Nwofor, Professor Le, and Professor Odenibo, made that recommendation and kept pressing on me to go serve. I didn't know what they saw. But I think what they saw is the reason why we are here today, celebrating this award. I want to sincerely thank them. I want to thank Otugo Nnewi, for seeing me and then for bringing me up to serve with you. Thank you, sir, for that opportunity, and I'm very deeply grateful for that. I also want to thank most especially my wife who is here. My wife made, during the course of that service, it was the most difficult period of my life. I can say that, the most difficult period of my life. But my wife made our home a paradise on earth. I can say that. She was the stability during that period, stabilizing factor during that period. Thank you very much, Dalo. And again, I want to thank the God Almighty who made it possible, for me to start as a Deputy CMAC and then finish as a CMAC. It is by His grace. So I most humbly, dedicate this very important award to God first, and then to the humanity which I served during this period. Thank you very much.
You can whisper something. I'm going to whisper now. Oh, whisper go and order loader. Mesizo to awega because our immediate past him okuchego oschago iboni in oya. So because I will appreciate to go straight to the figures. That alone. Akijiako. Praise the Lord. If you want to give us 1 million, give Kuloto. Our immediate past him. Thank you, sir.
Chairman of the House, I thank you for this privilege to kick off the ball. As a Nwofor, we were in the same department. I was already there long before he came. So there is no reason we should not support him with this distinguished award. So on behalf of myself and my family, we support this award, some 100,000. Wow.
Akijak, Igwa Bobosi, Ikuna line now. Igwa Bobosi, in on a line now. Igwa Bobosi, in on a line now. I echo up to go into this line. Manodiki, Iedechi Hewepu Ngwano.
All right, Professor Nwofor is like a brother and a friend.
You have done so wonderfully well, and I want to support him with a sum of 50,000 naira.
Thank you, Dr. Ken Okeke, 50,000 naira. My own teacher, Dr. Mene.
The chair. This is Susan no you born na asu tagi hairs. Motion boy kind. The great motion. If I kwesi keme. I mean 50,000 we support all hello.
Thank you so much, sir.
My CMAC, thank you for all you've done for us, and I appreciate every effort you did towards working with you. I'm supporting you with a sum of 20,000 naira. My name is Mrs. Osakuche, HOD MSS, Nayut.
Thank you, Mr. Sakwe. We know you. My prof again. Dalu, sir.
My 6th Emeritus. You know, this is a special award. Award in with after resigning or after leaving office. It's a special award. When you are there, the whole world will give you an award. This is a special award. It shows your capacity and your personality. So if in so because I thought I had supported before, but I will add 50,000 to support him. Thank you.
Thank you for your continuous support.
I am supporting the great works our CMAC, our immediate past CMAC did in Nayut. And I thank NMA for recognizing this. I'm supporting him with 20,000 naira. Thank you.
Yeah. No, it has never been like that. And thank you, my one and the chairman. I want to support my boss and mentor, under who I worked very well, and appreciate all his mentorship and leadership. I want to support this award given to him today with a token sum of 50,000 naira.
Thank you. Prof.
On behalf of my family, I want to support my brother. Some of you don't know, he's my brother. So I want to support him and pray for more awards on you. We expect more good things to come your way because you deserve it. You're a very good man. So I support this award with the sum of 50,000 naira. Wow.
Dr. Uden Nakachi Meze, he just whispered into my ears, and it was a loud whisper, the sum of 100,000 naira. Please, a hand of applause for him.
Agujebwe, thank you for bringing all of us together. My CMAC, Opulokana Youth, it's always a pleasure to support you and your beautiful family. Any day, anytime. Biko, Natu Fuyoge. Again, I want to support with a token sum of 20,000 naira.
Thank you. Otugo Nnewi. Hey, Dalori, Nosu no Gibo Batalia.
Yes, I'm like a father to all of us, all of them, and I'm happy that he didn't disappoint me, he didn't disappoint the community. He served very, very well, and he will continue serving, and wishing that he will go higher and higher in Jesus' name.
Amen.
By supporting a Boko Fanchono at the end.
No, Obuka no bro ni iji award enye microphone. Okay, Igwe Bobosi.
The able chair. Biko Boalba ne form mgbe iji wee form. Nkubi Ada Kocha Oploka, my personal person. And my boss or see nya pupana na before Luobona Enyechagoge Award and Chukwueme for Bona Akankudoye. You have left indelible mark in the annals of our teaching hospital. I won't say more than this. I joined
the entire NMA to give you this meritorious award. And on this, I'm supporting you with a sum of 100,000 naira.
Thank you so much. Odaloda. Make it a contributor. Okay.
Thank you very much. My name is John Nwofor. I work with Better Health. And we have a PPP with the teaching hospital. And Prof has been a very nice person to us. And I feel I should come up and support Prof. So I'll be supporting him with 20,000 naira, John Nwofor.
Thank you very much. CMD, ably represented. Thank you.
Again, it's not such a Oyibo. Let me just do, I'm on a CMD, I support CMAC, my immediate boss. Let me support again with 50,000 naira. Thank you.
Prof, obugo na enwere ife ọzọ igozie na anyị ọkwụrụ ọka. Thank you, sir.
No, wala. The state chairman, one, congratulations for an excellent tenure and landmark achievements. Second, thanks, recognizing my friend and close colleague, Okuloka. CMAC, I think everybody will agree that he was exceptional in that post. And the bottom line is that almost everybody you talk to will tell you that he is a good man. When people say you're a good man, in this present day Nigeria, it means you're almost a saint. Therefore, I support Okuloka. Yes, I support Saint Okuloka. I think we should add that saint to his name because he actually deserves it. I support him with the sum of 100,000 naira.
Thank you, Prof. Thank you. My own Prof, sir. I am chairman of the occasion.
Okay, I'm supporting with the same amount. Thank you.
The same amount is, I think, is 1 million, is it? My dean, sir.
We have supported before. So, Prof says that Nwofor, as I say, is a wonderful man. So, no need to add anything. I'm supported with a sum of 20,000 naira.
Thank you, Prof. Akulo Nonwe. Thank you, sir.
Emma, I've already called for all the awardees. I'm only here because Ogo is a very good man. So I'm supporting at all times. So I've supported all the awardees and I will remit it to NMA.
Thank you, Prof. Ezoku. Ahoma. Enyakwana nke di brief.
My chairman, I'm supporting my boss and Pastor Mark with 20,000.
Thank you. Abacha showing your support. Okay.
Yeah, I want to support my CMAC Emeritus for an excellent, well-deserved award. I'll be supporting him with the sum of 30,000 now.
Because the Vision 2030. Vision 2030 is NMA Secretariat. I area by then. I see boy, I see I'm on a high table. How did you go 2 times? Watching ML. No, Bossy. Thank you, sir. All right.
Thank you so much. Why the members of the high table, why they are settling down for the last special award to our CMD, the Mojega group. Use this time that they are settling down, please.
Okay, thank you so much for the opportunity. Good afternoon, our distinguished guests. We have a product here by name Mojega, which we are glad to present to us. I'm an obstetrician from the Nnamdi Azikiwe University Teaching Hospital here. And we have this product that has been key to our winning fight against severe anemia in our women as an add-on to the use of oral iron supplements for women who present to our center, typically with severe anemia within the regions of 5 to 6 grams per DL. And occasionally when they present to us, they come closer to term, around 37 weeks, 38 weeks, almost around delivery, with the risk, heightened risk of postpartum hemorrhage if another complications, if this severe anemia is not corrected. And here is a product that we found that within a short while of 2 weeks, using Mojega as an add-on to the hematinics we use, oral iron we give these patients, we've noticed rapid increase in the correction of these anemia in these women. We have cases of women who presented even recently 2 weeks ago, where within 2 weeks, HB of 6.2 was corrected to 10 in these women, and delivery was good, with good outcome of these babies. Knowing that this is a presentation of learned minds, I actually had a slide to show our evidence from studies conducted right from 2018 with the use of these drugs, and the likes of case reports published by one of us who is known, Professor Leje, known to this community well, and other studies, including a clinical trial, a phase 2 clinical trial on this same drug that has shown evidence that Mojega has done the work and has continued to do the work by improving the likelihood and the outcomes of these women by correcting anemia within a short while. I would like to remind us that severe anemia, if not handled properly, can also give us bad outcomes in these women because of the vicious cycle it has. Chronic hypoxia in these women that further leads to an increased state of inflammation, which further hinders the use of the oral iron that we often give these women by producing things like hepcidin. But the key in Mojega is that the extracts which it has been shown to reverse that trend. It has antioxidants in high amount that also mops up the radicals, free oxygen radicals in the system of these women who've been with chronic anemia. And essentially, it also provides iron, supports the absorption of iron, and also makes the iron that you're giving through the oral iron supplements available for absorption. Remember, a woman can receive oral iron as a chronic anemic patient and still not be able to use it adequately or have a prolonged time before she is optimized. But with Mojega, we've had good results with this. So because of want of time, we may not go through this, but right behind us in the stands is a good product that within our practices can help us optimize the outcome of our women and give us the best results in this community. The trial has been done. It's a multi-center trial spearheaded by the Nnamdi Azikiwe University Teaching Hospital in collaboration with our sister teaching hospitals, including that at Amaku, that at Ituku Ozala, and also that at Park Lane, and the results were similar. So we encourage you to get this product. It's effective. Within 2 weeks, we have the achievement of a pack cell volume of 8% or a HB of around 4 to 5%, which effectively gives this woman and their babies a fighting chance. Thank you so much.
Thank you very much. Please, AGM 1 starts after the next award. Pico, sit tight. We are starting the first AGM immediately after the next award. Thank you.
Distinguished colleagues, ladies, distinguished colleagues, ladies and gentlemen, while we recognize the presence of Dr. Mwabeze, ARD President, and Dr. Joy Okumokowut President, we also have in our midst Professor Obi Nwosu. Prof, it's a pleasure to have you. And we also have Igwaba Obosi, Dr. Monago, wonderful people in our societies. Distinguished colleagues, ladies and gentlemen, it's time for that award to our own CMD of Kout. No other person than Dr. Maureen Umakwelu, Permit me to invite Dr. Joy Okumo for the citation of the CMD of Coates for today's event. Dr. Waneli. Dr. Joy Okumo, the abstract, the summary of her citation.
Good day, distinguished ladies and gentlemen. Standing on existing protocol, I'm honored to be here today and standing out this moment to be the one to read on a citation of an exceptional leader. I call her exceptional leader for a purpose. Permit me to continue on that. This is a brief profile of Dr. Maureen Ume Akwewulu, Fellow, West Africa College of Surgeon, Fellow, Medical College of Obstetrics and Gynecology, Chief Medical Director, Chukwuemeka Odumegwu University Teaching Hospital, Oka. Dr. Ume Akwewulu, Fellow, West Africa College of Physicians, West Africa College of Surgeon, is a highly accomplished medical professional and a fellow of West Africa College of Surgeons, the National Postgraduate Medical College of Nigeria, and the International College of Surgeons. She is a senior consultant, obstetrician, and gynecologist with the National Hospital, Abuja, where she served in gynecologic oncology units. She is also an accomplished researcher with numerous publications, particularly in the areas of gynecology, oncology, women's well-being, and domestic violence. One of her works received recognition in the John J. Secretary International Journal of Gynecology and Obstetrics Prize Paper Award for the best clinical research article from a low and middle income country in 2021. She has also served as a reviewer for leading international journals, including British Medical Journal, Biomed Central Journal, and other reputable publications. Beyond her clinical and academic achievements, Dr. Ume Akwewulu has distinguished herself through professional leadership and humanitarian service. She currently serves as president of the Association of Catholic Medical and Dental Practitioners of Nigeria, Federal Capital Territory Chapter, and the president of the Medical Women's Association of Nigeria, Federal Capital Territory Chapter. She is also a council member of Society of Obstetrics and Gynecology of Nigeria. As the founder of the Donna Maureen Foundation, she has championed initiatives focused on women's health, children's welfare, girls' education, and empowerment of widows. Through her humanitarian outreach, she has provided free medical care to more than 400 indigenes of Ibuku and facilitated over 850 free cancer screening tests for women. Dr. Ume Akwewulu has received several recognitions for her professional excellence and philanthropic efforts, including the 2021 Woman of the Year Award by the Medical Women's Association of Nigeria. She is happily married, and the marriage is blessed with vibrant and promising children. Thank you. Ladies and gentlemen, I present to you an exceptional leader, a woman of valor. I call her exceptional leader for a purpose, and I've also concluded that she's God sent to Chukwuemeka Odumegwu University. Time will tell for us to understand what I'm saying here today. Thank you, ladies and gentlemen.
I know no other person will do justice to this citation than you, because I know what you do at our office from next week. So I want to hand the microphone to the chairman of the occasion for the next direction.
May I invite Professor Obinwosu? Obinwosu. I thought I saw him. Okay. Yeah.
Please, all the beautiful ladies in the house, please, you people should not fall hand though. Put an eba kunu support our Amazon. And the two proportional to size. All right.
You are going to present the award on our behalf.
Wow, that is an elevation. Okay. Yes. Madam, doctor, and very soon going to be a professor. You can take it as a prophet. On this occasion, Dr. Marin Uche Ume Ewel. Ume Ako Ewulu. That is Agwata. Good. On this special occasion, this state NMA has deemed it necessary and also found you highly qualified to be one of the award recipients on this occasion. And they've called my humble self as a past leader of this NMA at the state level to come and do this presentation. And I will not waste your word. And I will not waste the time of the people here. So without wasting time, congratulations.
Thank you, Prof, for doing justice to that presentation. Mommy, I get you microphone. Kai we malukwa ndị ya agbapụta gị maka na ọ bụ na ha agbapụtara gị nọrọ ebe a with us.
Good afternoon, my elders, the NMA Anambra president, the executives, noble elders all around me, my trainers, I can see a lot of them, noble colleagues, ladies and gentlemen. I am so happy to be here. First of all, I'm witnessing another way of giving somebody an award. Honestly, maybe I would have known. You know, Igbo people are very unique in anything we do. And I can see today. And I appreciate that. I'll first thank NMA Anambra that found me worthy to receive this meritorious award. When I was told, actually they came to my office and also my fine able president. I was so impressed. It hasn't been long I came to Anambra State. But of course, Anambra State is my home, Anambra, so I'm home. And you still considered me and gave me this award. I am quite grateful. And I also use this opportunity to thank His Excellency, Professor Charles Soludo, Oluwatuegwu of Anambra State, for also finding me worthy to come back home and serve my people. I'm quite grateful to him. And I'm happy to be home. NMA is NMA everywhere. I'm sure some of us must have met me maybe when we are having this and that national NMA. Apart from practicing my medicine with passion, because I see medicine as a privilege, and I feel all of us, first in being a medical doctor is a privilege, having the privilege to heal, to treat. Apart from that, I'm also somebody that is so passionate about association, with NMA inclusive. I've also held some position in our NMA FCT. I was one time vice chairman of NMA FCT. I've been in committees, even our current constitution in NMA FCT. I think the secretary of the committee. And when, yes, the current constitution we are abusing now, and you know, there was a time we had problem in NMFTT. I was also among the people drafted to look into it. In fact, I was the secretary. So I've been active in NMA. So when you called me and you welcomed me, it was like a homecoming. NMA Anambra, I am happy you recognized me. Wow. And I promise you, I'll be there. Anytime you call me, I will answer.
Thank you.
Yeah. I'm so sorry I came in late. If not for that passion in NMA, it would have been very difficult for me to come because of things happening that have to be going in and out of the lighthouse for what we are doing. But I told them, I must touch Nnewi for this opportunity. So I'm sorry I came in late, but we're having a lot on my table. My dear brothers and sisters, I don't want to talk much because I've seen the pattern. There are many to talk. Yes. And when I finish, I will also call every woman here because apart from being the vice chancellor, I'm still the president of M1FCT. Wow. Yes. So I expect once you're a woman, please still come out and join. Yeah. You must not necessarily donate, but I've seen that you must say something. Yeah. But you're a woman and you're a doctor, please come and join us because we lead with what? The love of a mother. Yeah. So please come up.
Thank you.
And no long talk, I'm going to mention one thing. Apart from an association, I have to plead to us, to elders. Look at our association, we have a lot to do. We must stand up for our association to succeed. The profession is a noble profession. The elders and all of us, we should not allow it to go down. We've seen a lot happening in medical profession. Our young ones are leaving. There is a need for us to stand up and correct it. We must stand for this profession. We must stand for our young ones. We must maintain the nobility of this profession. Please, today, I call on you that we all come on board. Finally, I will thank people that came out to support me. And also, I'm here with my management team, the head of account, the lab, the HNS, the PRO, the DCMAC. Wow. Ah, where is my CMAC? My CMAC, yeah, at least. Of course, president of LD. Then my sister, our community in charge of LT. Please, I thank all of you for accompanying me. Then to my trainers, there are so many. Professor Ikechebel, Professor Gwegwe, then I know that some traders you can. There's so many of them. Monago. Thanks so much. And since I am back, I'm your sisters, Anana Tagomo. I call on you to also join us in Kouth. We're beginning to do a lot of things. Just join us for us to move forward. My target thing for you is make sure that we turn it to center of excellence with global recognition. We've started, we'll move. We've gone completely paperless. We're doing other things to make sure that we move. And very soon, once you're around, okay, if you have headache, you come and enjoy our private wing clinic and we will treat you well. So, yeah.
Solution Trauma Center.
Yeah, I call. Okay, yes. And you know what? When I call His Excellency, Odenibo of Igbo land, we know what we are talking about. I hope if you are passing there, you will see a giant edifice. The only trauma center in Southeast. I'm not sure. Or is even South. I don't think there's a trauma center there. But he made it possible. Very soon, once you have anything trauma-related, please just come down to Chukwuemeka Odumegwu Ojukwu University Teaching Hospital, and you will be promptly treated. Thanks once again for the opportunity. I think we're civil servant and we are government professional. And of course, His Excellency said we can never donate in public. However, we've supported before and we are going to support again. Take it from us like that. So after all this, my head of account will meet you and give you what we can with.
Wow,
Thank you.
wow. Head of account will whisper to me, oh, in the same vein, we'll go, if I need bago, all the kwake kupo. Kunyo of man. I support this. I actually go to where you for me. If I need bago, or the arakago, I'm going to support mommy.
Welcome, CMD. Chukwemeka Nwako University Hospital, Amako. No. I can see my trainers here too. My former CMD, Professor Igwebe. They're all here. Professor Bingosu, Professor Udigwe, my brother, Professor Nwofor. I wouldn't mention names. We are all my classmate, Professor Umona Lihu, and my wife is here. Associate Professor Ucheume. We're all here. Please, you're all welcome. Please, I will not forget to mention also my brother and my trainer, and also Professor Ketchapel is here. Akabike is here, former CMD. Thank you very much for coming. No. I will give something, me and myself and my wife are going to give something substantial. Thank you very much. Say we should not donate in public.
I whisper since okay.
Please, just few minutes. I had a very serious omission. You know, you need to thank people you met and for you to continue. If they are not there, I wouldn't have met anything. I have to tell you publicly that people have been working in Chukwemeka Nwako University Teaching Hospital. And they've given their best. That took that great institution to the level I met them. So I have to also acknowledge the presence of my predecessor, Dr. Akabike. Thanks so much. Yes. Thanks so much for being there. Thanks so much for the work. It's from where he stopped that I'm picking up. And I have to acknowledge that. Thanks once again. And for other people that came out to support me, I've seen the trend. Please, I think they should say,
yes. In the same vein, let me recognize my predecessor too. Yes, Dr. Jane, the Amazon. Thank you. You're radiating the whole congregation. So, special recognition. So, can you take the microphone also?
Thank you, everybody. Let me stand on a already established protocol. Well, the asana okachalacha, and when you have listened to the speech of my successor, you will see that she's fully qualified for the job. And having tested government at various angles, at women level, I'm not surprised that it's going to do so much, because I know very much what we left that place and the challenges we have in state teaching hospitals. At times, it would have even been better to get some people from federal government and ask them to manage state teaching hospitals, so that we begin to see what we see. So I know it's not going to be a very easy thing, but I think she's facing everything forefront. It's not easy. So we thank you also for being an NM person. I was, because I was financial secretary of NM before I eventually became here. So you're welcome. And we're going to support Whisper. I think I've been whispering. I'm going to whisper again. So I'm going to whisper to the, because I've always been NM person, he knows. So I'm going to give you a support that is worth it. Thank you very much.
Thank you. With this whispering, my ears will go there for. Okay.
Our chairman and executive of Anambra, we thank you for recognizing our colleague, Dr. Mrs. Maureen Ome Akwewulu, to make it full. fishing her out and giving her this honor and recognition. Just few moments, just following her appointment. We're here to wish you well, to support you very well. And in that vein, I will support her, support VC and Nwofor with a total sum of 150,000 naira.
Thank you so much, Otugo Nnewi. Thank you for breaking the whispering.
The chairman, Nnewi Anambra State, distinguished colleagues here present, I am standing tall and happy to recognize the honor that has been given first to my Vice Chancellor, Professor Bond Stanley Anye here, and then now to the CMD, amiable CMD, quote, Chukwuemeka Odumegwu Ojukwu University Teaching Hospital. I feel honored standing here to share my appreciation of this recognition you're receiving today. And also, same goes to the Vice Chancellor, Nnamdi Azikiwe University. I'm standing on behalf of the Directorate of Medical Services, Nnamdi Azikiwe University, to support not just the two, also, I also want to make my token donation to support the immediate past CMAC, yes, Nnamdi Azikiwe University Teaching Hospital. I will be supporting this award with a sum of 50,000 naira. Thank you.
Thank you. Please, no more whispering. Everybody should talk something. Okuloka, I know you will talk.
Thank you very much, NMA Chairman. Congratulations, the CMD of Koyut. Okataracha, Adenye, Yana Fiozubo. So I trust from your speech that you are going to take Koyut to an enviable height. And I know you have started doing something marvelous in that institution. So congratulations again on your appointment and congratulations on this very important award. You deserve this. You know, people knew your antecedents. Don't think it's because you're here just few months. People knew who you are even before you came to Koyut and what you have done within the very just few months on that job. Congratulations. So on behalf of myself and then my wife, Associate Professor Ifoma Nwofor, we are, supporting this award recipients here, with the sum of 50,000 naira.
I shall go to go because of time, let's go straight to the point. Thank you.
Okay, I'm supporting my amiable CMD with the sum of 50,000 naira.
Thank you. God bless you, beautiful lady, for going straight to the point. Okay.
Good evening, everyone. My name is Nnemeka Umedum, and my CMD is here being honored today. So I'm going to support my CMD with a sum of 50,000 naira.
Thank you. God bless you, Ebo Simak.
Thank you, Anambra NMA, for honoring my capacity CMD, Amazon woman. If you see what is happening, transformation that is going on in Amak, you will tremble. I'm here on behalf of my family, my wife and my children, to thank you for this award and support her with a sum of 50,000.
Okay, thank you. CMD, because you were directed. Thank you.
Thank you all. I'm Dr. Okechukwu, medical lab scientist with Koyut Teaching Hospital. I'm here to support our CMD also with some of 50,000 naira. Thank you.
So much. Thank you, Dr. Mrs. Ume. I'm an whispering. Okay, no problem.
Good afternoon, all.
NMA chairman, all other persons available here, I want to use this opportunity to support my CMD on behalf of myself and my family with a sum of 100,000 naira.
Wow. Thank you so much. I did hatcher. My immediate past CMD, I greet you. Prof.
Thank you, my chairman, Nnewi Anambra. I'm standing here as a medical woman to support my very beautiful sister and our hardworking CMD. Before she became CMD, I was already working with her as the president of M1 FCT. And we know the stuff she's made of. We are not surprised at what she's doing already in Kowuth. So I thank NMA for recognizing her, and I'm supporting this with the sum of 20,000 naira.
Thank you, Prof. Thank you. Isn't it? I had a quote.
Thank you, Chairman NMA. I didn't know Mr. Dr. May before now. I've been hearing about great things happening at Kowuth until one day I went to visit an aunt and we were gisting and she walked in. And I was told she was the CMD I was hearing about. I've heard about the great things you have been doing in Kowuth, and I want to appreciate you. And I support your award with the sum of 100,000 naira.
The ARD code, Barata, but also saying on Azune so.
Okay. I don't want to say much because if I should allow to say, I would say till I'll continue to talk till evening. So permit me to support my exceptional leader. I call her God sent to codes. With time, everybody will understand why I call her God sent to codes. So on behalf of ARD Codes, we support the award with the sum of 50,000 naira. Then on my personal self, I'm supporting the award with the sum of 30,000 naira cash. Thank you.
Biko biana lunu mega na rumo kunaka. All right, thank you so much, Dr. Okumo Joy, an exceptional woman leader. I don't want to talk so much about you. You've been wonderful. You've been wonderful. Just keep it up. Prof. Prof. Okay, okay. Prof.
Thank you. Let me join others and appreciate the CMD. She's a well-known figure in obstetrics and gynecology. For those of us who don't know, she's also an examiner of the West African College of Surgeons. This was not mentioned. And national also, and national also. So you can see, those of them preparing for exams, it's better you actually come and support now. So, so that, and so I appreciate her coming to Anambra State and in Kowuth and support her award with the same sum that I have supported other awards. Thank you so much.
Olugo. I'm so happy to be here today. More about Dr. Mike Ikegolo Onoga. Oulo Posi. You couldn't have chosen a better candidate for this award. Enwe wine, when nuku wine. An Amazon of a lady who has brought so much innovation for the few months she has been in Kowuth. And we appreciate her for all that, and we want to encourage her. So I will support her with 50,000 naira.
And then about come and give you last. Okay. Na table. Okay, thank you, sir. Prof.
Okay, thank you very much. Already you could go 100,000 for all the awardees. I only came out to support a professional colleague and a sister. Nejisike, very proud of you. Dalo.
So I support the CMD. She's an obstetrician and gynecologist, who is my own specialty too. And she's now working in the center where I retired from lastly a few years ago. So I'm so impressed by her new appointment, and I hope to support the program with a reasonable sum, which I reserve my comments meanwhile. But I'll whisper to the to the chairman.
Mbadili Igbo.
I'm not putting on any cap, so I don't know how you recognize, how you managed to call me out. But where my Oga is concerned, I will not run away. Madam, you see, I want to say so many things. And by the time I finish, people will be feeling hungry. Therefore, I'll postpone my talk until tomorrow. Okuloka and the CMD. I am supporting both of them with the sum of 50,000 naira. Good. Thank you.
Thank you. Mbadili Igbo, daalụ rinne. Igwe Obosi, ngwan.
The lady, as we used to call you at those conferences, for those that do not know your ability, your capability, and what is embedded in you, they will soon know. These few months, like one of the speakers have said, go to Kout and see the positive changes. Just go and see for yourself and for the turnaround. This evening, I must tell you, I'm quite happy. One, a friend that has served and finished got this award. And the friend that has just taken the mantle to turn around positively of one of our sister teaching hospital is being recognized. On this note, when I was supporting Okloka, I said 100,000. I want to increase that of Okloka to 150,000. And so that I can equally support the Amazon lady with a sum of 150,000, making 300,000 altogether. Thank you.
Igwabo Obosi. Tonya Igwabo Obosi. Tifomene. Bozero.
Yeah, thank you so much. Afambo Professor Mono Nihu. Maureen Bo, I need to have the oil and gas. Most importantly, money I have the oncology. So we are in a committee together at the National College. I don't ask how fast we do. So I want to support you because you are one of our own. The ONG, I am Aquado and I am blessed to even a southeast ever no one. Oil and gas, so 5 CMDs in this southeast. And here, just this year you can CMDs 5 in the southeast. So and very soon I multiply, yeah. So thank you very much. I am not going to mena code. Yeah, mekaling. I just sample kafanafo. So I'm going to support this award with 50,000 naira.
Thank you, Prof. Biko Dalu Norine for your support. We may now retire to our various. Oh, they call the Leku Beroku. Oh, the Leku. Oh, the Leku. No, now. Hi. What? Bayaku or CMD call.
I must support the CMD. We'll be talking on phone, but we don't know. Today I'm seeing for the first time. So we're talking of 20. Let me just add it.
Okay, all the late 20 Nandin call. Also, no make it go na ego CMD nyele agugo. All the low where because I want to appreciate everyone for this support to our various awardees. I'll hand over the microphone to the MC for closing formalities for the first session before we move to our AGM. We are starting AGM today so that tomorrow we won't waste time going to the elections. Thank you.
Distinguished colleagues, ladies and gentlemen, may I quickly invite our CMD, Dr. Odilo for.
Okay, ladies and gentlemen, time well spent, but I must talk. The CMD said I must appreciate all of you. Our vision has been said, and let me just say, the CMD said I should bring his appreciation to you. We talked about what he's doing in our youth, a visionary reader. So he want to appreciate the NMA. And he's telling you that Nayut is our hospital, that you should feel free to come and help to contribute. That our vision, to key into our vision and make sure that our Nayut, if you look at what he has achieved with the team, you find out that he overshot his vision, that vision 2030. So the CMD say that he has been supporting the NMA. Of course, the lecture we have today is a visionary handwork of our CMD. That's Professor Baja. It was the person that suited it when it was NMA Nnewi zone, and they handed over to us that continued it. So he has been an NMA man, and he continues to support. And now you supported very well for the organization of this occasion. So the CMD appreciate all of you and want you to help him to build Nayut to be the best in the whole world. Thank you, and God bless you.
Thank you, CMD Nayut, ably represented by Dr. Odilo Okoye. Distinguished colleagues, ladies and gentlemen, may I quickly invite the scientific session chairman for the appreciation for the chairman of today's occasion, Professor A.M.E. Nwofor.
Thank you very much once again, dear compare for today, Dr. Ima Obiesi Arinze. Ladies and gentlemen, you agree with me that it's been a time well spent. And the person who piloted this opening ceremony and lecture and awards has been none other than Professor A.M.E. Nwofor. Chair, please, Chair NMA, you need to perform this function. It's very important. And he came in on time for the event, sat in with us. He's a medical elder. And you can see the maturity, the stability with which he has guided this very event up until now. Just before he makes his closing remark, I think it's about time to also appreciate the person that has been appreciating everyone. So we have a token of appreciation for our dear chairman of today's occasion. May I invite the chairman of Anambra State NMA, Dr. Princeton Okam, to come and make a presentation of a token of appreciation to the chairman of today's opening ceremony, lecture, and awards, Professor A.M.E. Nwofor. Chair, here is the token.
Please, standing on the already established protocols, ladies and gentlemen, I have the singular honor to present this award to a man I respect so much, who is like a father to me. He was of great support and assistance to me when I was the zonal chairman of NMA, Nnewi Zone, 2020 to 2022. Prof, you've always responded to my call and cry. You've always advised me. You've loved me with the love of a father. I don't play with you, sir. So thank you for doing us the honor of sharing this beautiful occasion. And one thing that is remarkable about this man is that soon Afro can get si wega. So, Prof, thank you. A blessing to us. Please do not abandon us. Continue to hearken unto us when we call upon you. Our prayer is that God will continue to bless and keep you, sir, and keep you in good health. I therefore present this award to you as the chairman of the occasion of the 2026 NMA AGM, 6th Emeritus Professor Aghagbo Nwako Memorial Lecture and Awards, presented this day, Friday, 17 July 2026. Congratulations, Prof.
Chairman Nnewi Anambra State, past chairman, colleagues, ladies and gentlemen, anything that has a beginning also will have an end. I'm so happy today. Everything has gone so well. And it gives me great pleasure. I was the chairman of this Anambra State NMA from 1993 to 1997. And that time we had a lot of energy. And that was shortly after the new Anambra was created. So we had a lot of issues at them, but we were able to overcome them. Today, when you look around, you see so many people. And people are committed every day to the cause of NMA. I'm so happy about that. And I am going to support whatever we are doing here with 100,000 naira. And my message generally is that we continue to be peaceful in NMA and Anambra states. Because in some states, it's a lot of problem. So we should continue to maintain the status quo. As in onye asinya jideka ujo, man even them. So I thank the current executive. They've piloted the affairs very well. And I believe that by tomorrow, as we hand over to a new group, they will also imbibe the same culture. On that note, I think we've come to close of this thing. We now get somebody for the vote of thanks. Thank you.
Thank you so much, the chairman of today's occasion, Professor Nwofor. May I quickly invite Dr. Anthony Ude for the vote of thanks. Dr. Anthony Ude. Professor Ugu, Dr. Ude is not here. So let me invite Professor J. Ugu.
Well, what more can I say? I think it's been an amazing day. I want to first and foremost thank God Almighty for his mercies, for the clement weather, for granting unto everyone that travel from far and near safety as they journeyed from Enugu and from different places to join us here. I want to, in a very special way, thank our dear chairman of the occasion today. I want to thank you because you accepted this responsibility despite your tight schedules, and you have done it excellently well. The 6th Emeritus Professor Festus Aghagbo Nwako lecture. You didn't only lecture us today, you sent reverberating and resonating messages across that will speak for generations and then bear fruits in time to come. I want to thank you so much for accepting to be with us. While you were giving that lecture, we saw excitement, we saw zeal. You delivered that lecture with your heart, and that is highly appreciated. May I also appreciate our past CMD, Otugo Nnewi. When we see you, we are excited. When you are in our gathering, it takes a different color. We are delighted having you. Thank you so much. May I also thank in a very special way the chair of the first scientific session. And he came before all of us. And we made no mistake when we said and asked and requested that he be the chair of the scientific session. Professor Gerard Odigwe, thank you so much. It's always a pleasure having you. The Chief Medical Director, Nnamdi Azikiwe University Teaching Hospital, here represented by Dr. Odili Okoye. Sir, you are welcome for your contributions, for your support, and for your presence. We do not take it for granted. The awardees, I'd like to extend gratitude to all the awardees who have been honored today. You are part and parcel of us. And as I pass this message in a very special way, I extend this message to them through Professor Ogoeze Nwofor and the wife who are here. It's such a huge delight that we could have men of our stock who could represent us in administration, in academics, and in other spheres of life. We are indeed proud of you, and we shall continue to celebrate you. May I thank the chairman, NMA Anambra State, Dr. Princeton Okam. Sometimes I wonder how many things go around in your brain. You're a great coordinator. Thank you for assembling us. Thank you for the guided liberty. Thank you for giving us all that we needed to see and giving us the mandate to execute a very beautiful conference. May I thank also our dear elders, the team speaker, Professor Tim Yumberi, the sub-team speaker, Professor Richard Nwofor, elder, our past NMA chairman, Anambra State, members of the State Officers Committee. May I thank our professors who have found time. You could have been anywhere. You could have been doing something else. I make bold to say that anyone that attends a function has left 2 or 3 forgone to be at that particular function. I want to thank the choir. Your renditions were serenading. Thank you very much for being here. The DJ, the ICT, and everyone who has made this conference what it has been and what it is going to be. I want to thank all the members, distinguished members of NMA Anambra State, our invited guests, members of the LOC who have worked tirelessly, had sleepless nights to make this conference happen. We want to say a very big thank you. We have only started. We are going into the AGM. Tomorrow we are starting this second scientific session by 8 a.m. And that's how we are going to move tomorrow. After that, we are going to easily move into the sub-theme lecture and the theme lecture. We have Professor Richard Nwako talking to us tomorrow. Many years ago as a registrar, I was in clinic and there was an event going on at Metu's Odiko Auditorium. And Professor Nwako was there giving a lecture. I was a registrar. And Professor SNC Anyanwu came to clinic and said, "What are you doing when Professor Nwako is giving a lecture?" So I had to abandon clinic to go and listen to Nwako and come back later on. So we are going to have such experiences when seasoned colleagues of ours will be talking on the theme and sub-theme tomorrow. And remember too, we shall be having our election and then the AGM proper will be concluded tomorrow. Having said all this, once again, I say a very big thank you. And may the Lord God Almighty guide us home respectively in Jesus' name. Thank you very much.
Thank you so much, distinguished colleagues. We are now transiting into the general meeting.
Thank you, the MC. The high table is hereby dissolved as we move into the AGM. Please, Secretary NMA Anambra State, please approach the high table. At this point, I will respectfully ask our guests who are non-medical doctors to excuse us as we move into our AGM. Thank you for being with us. We appreciate your presence. May God bless you as you join us once more tomorrow.